Thank you, sir. A warm good evening to all. On the eve of system clear on the eve of World Mental Health Day, Medical Service Center, Karnataka organized a webinar on burnout phenomenon among the health professionals. And today I welcome Dr. Dhruva Aithal, MD, PhD in Psychiatry, NIMANS, and Consultant Psychiatrist in Bangalore. I heartily welcome you, sir. And also, I welcome all the MSc members and today's viewers. And now I request Dr. Vasudhara, sir, to continue this program.
Thank you, Dr. Upendra. Warm welcome to each one of you. Today's topic, I think it's a very relevant topic. Basically, burnout phenomenon, I think Dr. Dhruva Aithal will elaborate, is one of the important issues nowadays affecting not just doctors, but all levels of healthcare who are working in health field for various reasons. On the occasion of World Mental Health Day, which happened last week, we discussed which topic that can be brought in for discussion. And we thought this is a relevant topic, and we discussed with several others. This phenomenon is rampant, and we thought it is better to understand it more, address it, and discuss about it. So we have organized this webinar, and we are happy that many seniors, doctors, nursing staff, ICU workers, then we have other various different students, PGs and all who have gathered here. I hope we'll have a good discussion on this topic. I request Dr. Aithal sir to make his presentation. And after that presentation of 15-20 minutes, I request some personnel to present their views, say for 5 minutes, and then the house is open for discussion. And probably in the end, I think Dr. Dhruva Aithal will give some solutions or how to overcome this problem. So with this very brief introduction, I hand over to Dr. Dhruva Aithal to start his presentation, please.
A warm good evening, everyone. Thank you, Dr. Vasudhendra and Dr. Upendra for introducing me to the board. I want to start the presentation by thanking Medical Service Center, Dr. Gangadhar, for giving me this opportunity to be here presenting on very important aspect in today's world, which is burnout. Yes, it is on the occasion of World Mental Health Day, and this year's theme for World Mental Health Day is mental health care for all, make it a global priority. When we say all, the first, of course, is the medical health professionals. Though we are very close to the healthcare facility, but when it comes to mental health care and then accessing it, it is not the problem of distance, because all of us are very closely working with medical facilities, but probably our internal systems, our own stigmas, our own kind of hindrances lets us not access mental health care when it is needed. So today I'm going to present about burnout, and then let's take the discussion as Dr. Vasudhendra already said, and then finally a few tips on how burnout can be managed. I think one of you have to let me enable my screen sharing thing. Either I have to be a co-host or a host so that I can present my PPT.
Varsha?
Yes, sir. PPT present, sir. Is there not a share option there?
Host disabled participant screen sharing is the message for me. I think you have to make me co-host or allow presentation.
Sure, I'll make you host, then you can present, sir.
Making me co-host is better, I guess.
Sir, I couldn't find an option for co-host. Now you can present, I guess.
If there are participants waiting, then in between the presentation, it becomes difficult for me to allow them to the meeting if I'm.
So they'll join by themselves with password and everything. So you need not do anything for participants to join in.
Okay, so the host need not give permission for them to join, right?
Yes, sir.
Okay, if anyone reaches out saying that they are waiting in the waiting room, I
Okay.
need to allow them, please let me know.
Okay, sir. Yes.
So, yeah, today's topic is about burnout, particularly among healthcare workers. We being the frontline workers when it comes to health, whose importance has been stressed repeatedly in the recent pandemic, that we are just coming out of it. So, 1 minute, I'm sorry. So, what are we discussing today? We are particularly discussing about what is burnout. I'm sorry about the spelling. Why does this happen? And then we will keep the floor open for each one of your experiences about burnout, when finally I will be concluding about how to handle it, and then in general about mental health, few slides if the time permits. Mental health, because many of us are working closely with mental health, I am not going into the WHO definition of mental health, because, which of course most of you may know, it is a state where you realize your potentials, be able to cope with the usual stresses that life poses, and then thus work productively and then fruitfully contributing to the community. Yes, that is something that most of us know. What I need to stress upon when it comes to mental health, particularly among medical professionals, is I know many of my friends whose relatives are suffering from one or the other mental health problems, but we, being the mental health professionals, have the stigma. Okay, it is nothing. Probably it will go away. Let me not go to the doctor, and only end up coming when it is actually severe enough. Maybe it is our stigma to seek a mental health service at the earliest. Maybe it is something else I think we need to recognize. When I say this, it doesn't end at other medical professionals. It includes mental health workers as well, including me. For example, my mother was complaining of minor problems with memory, and I did not consider it to be seriously related to dementia, because no, I don't want her to be having dementia. So I kept postponing it till the day it was actually serious enough to go and seek help. So these are the ways in which all of us, people who are working in the area of mental health, can be having our own attribution biases towards mental health, and thus prevent seeking mental health. Then coming to the topic of today, which is burnout, which is defined as the severe form of work-related stress. So before going to burnout, I want to stress on what is stress. Yes, stressing on stress, which is definitely not a disease, but a reaction to imbalance between one's abilities, knowledge, to what is needed out of him, the job demands or the pressures, which leads to difficulty in coping. So it is something that all of us face day in and day out. Somewhere we may feel we are not equipped enough to face what we have to do. Burnout, which was initially used by Herbert Freudenberger in 1990, though the burnout word was new, that it has been in the history since Shakespeare. They say in Shakespeare's drama, he has given similar instances, and then in between Americanites was something that was used, and neurasthenia was one of the neurologist definition of burnout. Basically it is a result of chronic workplace stress which has not been successfully managed. Now you find it even in International Classification of Disorders. It was there in ICD-10. It has found a place in ICD-11 too, where they say it is characterized by three important dimensions. The first dimension being feeling of energy depletion or exhaustion. Second one being increased mental distance from one's job, or feeling of negativism or cynicism related to one's job. And finally, reduced professional efficacy. Malash is one psychologist who has worked very closely with burnout, and he has found these characteristic features dimensions into three. One, the emotional exhaustion. The second, depersonalization, where one person feels he is to be different than what he is usually. And finally, reduced personal accomplishment, not able to do what one can do in his best. So this is one of the studies from India after a recent pandemic, where we found that the emotional exhaustion and depersonalization symptoms among our healthcare workers, this study, if I'm not wrong, was focusing on the nurses who were working as frontline workers in pandemic. It was more common than reduced personal accomplishment. How do we differentiate between stress and burnout? Because stress is something that all of us have day in, day out. Is everything is burnout? Probably not. Probably this table is going to help us differentiate between what is usual stress, what is the state of burnout. In stress, you try to engage more and more so that you can solve the problems, whereas in burnout, you want to disengage and then feel distant from what is happening. Emotionally, you are overreactive. You are either on your toes, you are angry, you're irritated, whereas in burnout, you're apathetic, you're not reacting, you're blunted. And stress causes you to work more, whereas in burnout, you feel helpless and hopeless. You feel loss of energy during stress. In burnout, you may feel loss of motivation, and even ideals and then hopes are lost. Usually stress is known to lead anxiety disorder. However, this is not all or none phenomena. It can also lead to depression. But in burnout, it can lead to detachment and depression more commonly than the stress. Primary damage in stress is said to be physical. However, emotional and behavioral aspects are also there to stress-related damages. However, in burnout, primary damages to your emotions. Yes, there is physical here as well. It may kill one prematurely. That's the importance that one need to deal their stress effectively. And in case of burnout, it may make life seem not worth living at all. How do one identify whether they are stressed? These are few of the questions which I'm not going to read out one by one for all of you to go through and then see whether you have had this in your life, in your work life particularly. It is said that the healthcare workers or anyone where the person need to be compassionate about other human being, like medical professionals, like police, like teacher, the burnout phenomenon is more common because all of us have a limitation to show our compassion towards the other person. In a profession where showing compassion is the primary necessity, over time, when you are doing more than what is needed, because in most of the Western countries, they say 40 hours per week is the norm for one to work. But we Indians work more than that. If allowed, we will work 18 hours a day for 6 days, even 7th day also, which leads to what is called as compassion fatigue, where you no longer feel that you can feel for the fellow human being or a worker, a colleague, for example. A patient walks in and then says pain and you feel numb. You cannot say, empathize with their problems. That is what is called compassion fatigue. And because we day in and day out, with every patient who walks in, we develop, if we need or if we want to or if we don't want to, we develop an emotional bonding with them. It may be of higher intensity or lower intensity, and what happens to them affects all of us in one way or the other. Thus, in our profession particularly, we are at a higher rate of getting burnt out because, as I was previously stating, emotion is predominant when it comes to burnout, along with the physical thing, where in stress, it is the physical signs which come up fast. what causes the burnout? Most often it is related to the working environment. If one feels that we have no control over our work, say, even if you are working in your own private setup, but you feel that no, you cannot take one day off, you are because there is a lot of patients waiting, or your workplace doesn't let you control your own life, then that is one of the reasons. Whatever the work you do, if you feel it is not being recognized, not rewarded with monetary benefits, that is another reason. Unclear and overly demanding job expectation. In medical profession, all these are the things that we see day in and day out, irrespective of where we are working, who are we working for. And in some way it is monotonous, and for some it is also unchallenging at various levels of our medical profession. And working in a chaotic and high pressure environment, all those who were working in pandemic and also those who are working in the emergency medical situation, it is one chaotic and high pressure environment, all of which can lead to burnout. There can also be lifestyle related causes for burnout, working too much, not giving enough time for one's own personal life or family life, and not because you're not spending time with them, you do not nurture them, and you end up having no close or supportive relationship, and you take up too much responsibility either to please your boss or to prove yourself that you're invincible, you can do enough, and then not getting enough sleep, which can also lead to burnout sooner because it is related to emotions. Some of our personalities, all of us tend to idealize those particular characteristics, and one important one is perfectionism. Everyone, all of us wants to be perfectionist. Yes, there is nothing wrong in being perfectionist, but it comes with its own demerits. One of them is it's going to be extremely taxing on you, and emotionally particularly. Few people in general tend to have a negative view about everything, whatever is and pick the negative first, even in a pool of positives mixed with negatives. So those kind of persons may be at higher risk of developing burnout. And those who want to be in control all the time and who cannot give smaller tasks to others because they're not sure how is it going to be carried out. Those who are high achieving and type A personalities. I can say this as a general statement, of course, not generalizing it per se. Most of us, the medical health professionals, belong to these categories, one or the other of these categories. What happens biologically, not going into detail, because all of us know whenever there is a stress, there is release of ACTH and adrenal glands release adrenaline, which leads to many of the symptoms which most of us have learned during our undergraduation, and that leads to most of the physical symptoms. We should not forget that optimal stress is the one which leads to high performance. If there is no stress, probably most of us are sleeping. But burnout happens in this stage where stress is more and performance comes down as a result. How much stress is okay is a question, and what leads to burnout is a question which has no particular answer, because it is not just work that we all have in our life. We may have simultaneously personal challenges that we are dealing with, our own experiences of trauma and abuse in the past, our own set of genes and developmental experiences, and the responses that we have sought to either to fight or to flight, and then with respect to our diet or habits or drinking or exercise, all of which leads to physiological response, thus leading to a load on the body, which is called allostatic load, and thus lead to, this is the biological events which happen in a burnout. And often we say, I'm dealing with the same amount of stress, why only my colleague is facing so much of problem? It is because this black thing which we call as vulnerability is very personal to all of us. For some it is less, so you can tolerate more stress. For some it is more, where it becomes overspilling, and then you have what are called as the consequences of stress, which are psychological or psychiatric problems. So the current understanding of any psychiatric problem is that your genes, which is inherited from your parents, along with the experiences that you have seen in the early life, which is nurture, will lead to some assumptions and beliefs, the way we deal with the external factors and form our thoughts. And thoughts, feelings, and behaviors are very closely connected. When there is an external trigger, which comes in the form of pandemic, for example, financial loss, divorce, marriage, there can be what is called a psychiatric problem. This is biopsychosocial model. Most of you may be already aware of it. What are the symptoms of burnout? Physically, one can have headache, GI symptoms, body ache, tiredness, ulcers, hypertension. And of course, burnout is not a medical diagnosis yet. It is a condition which affects the work. These are the symptoms which might not have any underlying organic cause. Psychologically, it can lead to worry, tension, sadness, frustration, irritability, decreased attention and concentration. Behaviorally, may affect your sleep, appetite, weight, lead to increase in substance use among those who are already using. Individual level, it can lead to decreased performance, may lead to psychiatric problems like anxiety and depression, and poor decision making. Substance misuse at family level impairs your relationship with your closed ones, may affect the financial situations. At an institute level, it leads to frequent conflicts, poor relationship, and reduced productivity as a whole. Emotions. I will complete it in another 2 slides, important 2 slides, and then let the floor open for people to discuss about their own. Why do we have emotions? The understanding currently is it is an internal reward system. If you have a positive emotion, say happiness, feeling surprised, you would tend to do the behaviors which led to that. If it is a negative emotion, say anxiety or depression, you would try to do the events which led to that. So, but the point is, most of us are culturally, we always have an aversion towards negative emotions. The moment a child cries, we tend to say, don't cry. While it is totally okay for one to be sad and be anxious, we always say, be strong, be brave. So these are the things that are culturally taught to us, but only now we realize, irrespective of whether it is positive or negative emotion, it is important to acknowledge them and manage them effectively. And anger, like many other emotions, is very important because that is how the stress expresses itself. It is initially known to help in survival, but over time, because we are no longer fighting with our predators, the anger is a result of, or it is a negotiation for better treatment in any workplace. But usually it gets combined with most of our emotions are combination of many other things like mistrust, hurt, jealousy, sadness, even fear for that matter. I will not go into the details of this. I just wanted to tell you that there are a few things most of you might already be aware as what are all the symptoms of anxiety. These are all the symptoms of anxiety, and similarly the symptoms of anxiety disorders. When more than one symptom is there, then it is diagnosed to be having with following disorders. I'll not go into the details because I know most of you are working in the mental health care area as well. Even depression can be the result of burnout, suicide in severe cases, and it is a preventable cause of death. So that is the importance of burnout. It can lead to anxiety, can lead to depression, and even suicide. Psychosomatic symptoms, when it is not to the extent of diagnosing with any of the emotional or psychological disorders, it can lead to physical symptoms which are unexplained by organic conditions like headache, nausea, vomiting, abdominal pain, dissociations. Before going into this, I want to take a break and then pause for everyone to share their experiences of burnout and what do they feel about burnout. I'll take another 10 minutes as how to deal with the burnout at the end of the session.
Yes, thank you, Dr. Dhruva. You have elaborately covered basic aspects of burnout and what are the general causes. And of course, we'll discuss at the end how to manage this problem. I'll request some of the participants to share their experiences, what they think about this problem. Have they faced this problem while caring for the patients? ಇಲ್ಲಿ ಜ್ಯೋತಿ ಅಂತ ಇದ್ದಾರೆ ICU ನರ್ಸಿಂಗ್ ಸ್ಟಾಫ್. ಇದೀರಾ ಜ್ಯೋತಿ ಅವರೇ? ಇದ್ರೆ ನೀವು ಶೇರ್ ಮಾಡ್ಕೋಬೋದಾ ನಿಮ್ದು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಈ ಬರ್ನ್ಔಟ್ ಫಿನಮ್ ನಿಮ್ಗೆ ಆಗಿದೆಯಾ ಅಥವಾ ಏನ್ ಅನ್ಸಿದೆ ಅಂತ?
Hello. So,
Hello.
one
Hello.
minute.
ಹಾ ಇದ್ದಾರೆ.
Sir,
Hello.
can you ask Dhruva sir to make MSc Karnataka host again?
Okay. Dr. Dhruva, can you make MSc as host once again?
Already.
So can you go to settings and claim to be host? You can claim to be host. In that way, I can make you co-host. There's option there, more.
In the more, I get only pin and then other thing.
Okay.
It's okay. When I need to present, you can make me a host again.
Okay. Yes.
ಹಾ ಜ್ಯೋತಿ ಅವರೇ ಮಾತಾಡಿ. ನಿಮ್ಗೇನ್ ಅನ್ಸುತ್ತೆ ಏನು ಅಂತ, ಯಾವ ಊರು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಳಿ.
Okay, sir. Thank you for inviting this discussion to me. Sir, ನಾನು ಕನ್ನಡದಲ್ಲೇ ಮಾತಾಡ್ತೀನಿ.
ಓಕೆ ಮಾತಾಡಿ.
ನಾನು ಪ್ರೊಫೆಷನಲಿ ಸ್ಟಾಫ್ ನರ್ಸು. ನಾನು ದಾವಣಗೆರೆಯಿಂದ ಮಾತಾಡ್ತಾ ಇರೋದು. ನಾನು ಕೂಡ ಈಗ ಸ್ಟಿಲ್ ವರ್ಕಿಂಗ್, ನಾನು ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಈ ಒಂದು ಟಾಪಿಕ್ ನಾ ಇದುವರೆಗೂ ಕೂಡ ಮಾತಾಡಿದ್ರು ಡಾಕ್ಟರ್ ಧ್ರುವ ಅವರು. ನಾನು ಕೇಳಿಸ್ಕೊಂಡೆ ಎಲ್ಲ ಯಾವ್ಯಾವ ರೀತಿ ಸ್ಟ್ರೆಸ್ ಆಗುತ್ತೆ ಈ ಬರ್ನ್ಔಟ್ ಬಗ್ಗೆನೆ ನಾನು ಎಲ್ಲಾ ವಿಷಯನೂ ಕೂಡ ತಿಳ್ಕೊಂಡೆ. ಬೇಸಿಕಲಿ ನಾವು ಕೂಡ ಅನುಭವಿಸಿರ್ತಕ್ಕಂಥದ್ದನ್ನ ನಾನು ಇಲ್ಲಿ ಹೇಳ್ತಿದ್ದೀನಿ. ನಾನು ಕಾರ್ಡಿಯಾಕ್ ICU ವರ್ಕ್ ಮಾಡಿದ್ದೀನಿ. ಸೊ ಸ್ಟಿಲ್ ಇವಾಗ್ಲೂ ಕೂಡ ನಾನು PICU NICU ನಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ನನಗೆ ತುಂಬಾ ವರ್ಸ್ಟ್ ಅನ್ಸಿರೋದು ನಾನು ಕಾರ್ಡಿಯಾಕ್ ICU ನಲ್ಲೇ ಕೆಲಸ ಮಾಡಿರ್ತಕ್ಕಂತಹ ಅನುಭವಗಳು. ಯಾಕೆಂದ್ರೆ ಅದು ನಾನು ಮಾಡಿರ್ತಕ್ಕಂಥದ್ದು ಕಾರ್ಪೊರೇಟರ್ ಸೆಕ್ಟರ್ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಮಾಡಿರ್ತಕ್ಕಂಥದ್ದು. ಸೊ ಅಲ್ಲಿ ಇನ್ನೇನು ಕಾರ್ಪೊರೇಟರ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಂದ್ರೆ ಹೆಚ್ಚು ನಾವು ವೇತನ ಅವರು ಕೊಡೋದಕ್ಕಿಂತ 10 ಪಟ್ಟು ನಮ್ಮ ಕಡೆ ದುಡಿಮೆನ ತಗೊಂಡಿರ್ತಾರೆ. ಸೊ ಆತರ ಒಂದು ಹೆಚ್ಚು ಪ್ರೋಟೋಕಾಲ್ಸ್ ಗಳಿರುತ್ತೆ, ನೀತಿ ನಿಯಮಗಳನ್ನ ನಾವು ಅವಕ್ಕೆ ಒಳಪಟ್ಟಿರ್ತೀವಿ. ಸೊ ಹಂಗಾಗಿ ನಾವು ಹೆಚ್ಚು ನಾವು ಫಿಸಿಕಲಿ ಮೆಂಟಲಿ ಕೂಡ ನಾವು ಸಾಕಷ್ಟು ಕಿರಿಕಿರಿ ನೆಮ್ಮದಿ ತಾಳ್ಮೆನೂ ಕೂಡ ಕಳ್ಕೊಂಡ್ಬಿಟ್ಟಿರ್ತೀವಿ. ಆತರ ನಾವು ಕೆಲ್ಸಗಳನ್ನ ಅಲ್ಲಿ ಮಾಡಿದೀವಿ ಕೂಡ. ಸೊ ಇಲ್ಲಿ ICU ಅಂತಂದ್ರೆ ನಾವು ಹೆಚ್ಚು ನಿಗಾ ಇರ್ತಕ್ಕಂತಹ ಒಂದು ಸೆಂಟರ್ ಆಗ್ಬಿಡುತ್ತೆ. ಅಂದ್ರೆ ICU ಅಂತಂದ್ರೆ ಹವರ್ಲಿ ಮಾನಿಟರಿಂಗ್ ಇರುತ್ತೆ, ವೈಟಲ್ಸ್ ಇರುತ್ತೆ. ಆ ತರದ ಎಲ್ಲಾ ಪೇಷಂಟ್ಗೆ A to Z ಕೇರ್ಗಳನ್ನ ನಾವು ಕೊಡ್ಬೇಕಾಗುತ್ತೆ. ಯಾಕೆಂದ್ರೆ ಹೆಚ್ಚು ಅಲ್ಲಿ ಅಟೆಂಡರ್ಸ್ ಗಳಿಗೆ ಅಲೋ ಇರೋದಿಲ್ಲ. ಎಲ್ಲಾ ಕೇರ್ ಕೂಡ ನಮ್ದೇ ಆಗಿರುತ್ತೆ. ಡಾಕ್ಟರು ಬರ್ತಾರೆ, ಹೋಗ್ತಾರೆ, ರೌಂಡ್ಸ್ ಮುಗಿಸ್ಕೊಂತಾರೆ. ಅವರು ಏನ್ ಇನ್ಸ್ಟ್ರಕ್ಟರ್ ಇರುತ್ತೆ ಅದನ್ನ ಇನ್ಸ್ಟ್ರಕ್ಷನ್ ಹೇಳ್ತಾರೆ. ಸೊ ಫಾಲೋ ಅಪ್ ಮಾಡೋರ್ ನಾವಾಗಿರ್ತೀವಿ ಅಲ್ಲಿ. ಸೊ ಹಂಗಾಗಿ ಹೆಚ್ಚಿನ ಜವಾಬ್ದಾರಿ ಪೇಷಂಟ್ ಗಳನ್ನ ನೋಡ್ಕೊಳೋದಾಗಿರ್ಬೋದು, ಅಥವಾ ಅವರು ಹೆಚ್ಚು ಕ್ಯೂರ್ ಮಾಡ್ಲಿಕ್ಕೆ ನಮ್ಮ ಒಂದು ವರ್ಕ್ ನಮಗೆ ಹೆಚ್ಚು ಜಾಸ್ತಿ ಅಲ್ಲಿ ಕಾಂಟ್ರಿಬ್ಯೂಷನ್ ನಮ್ದು ಕೊಡುಗೆ ಬರೋದು ಅಂತ ನಾನು ಅನ್ಕೊಂಡಿದೀನಿ ಇಷ್ಟು ದಿನದ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ನಲ್ಲಿ. ಇಲ್ಲಿ ಈಗ ಸರ್ ಹೇಳಿದಾಗೆ ನನಗೆ ಈ ಒಂದು ICU ನಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ಬೇಕಾದ್ರೂ ಸಾಕಷ್ಟು ಫಿಸಿಕಲಿ ಕೂಡ ಕಿರಿಕಿರಿನ ನಾವು ಅನುಭವಿಸಿದೀವಿ. ಯಾಕೆಂದ್ರೆ ಅಲ್ಲಿನ ಹಾಸ್ಪಿಟಲ್ಸ್ ಗಳಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ಬೇಕಾದ್ರೆ ಅದನ್ನ ನಾವು ಟಾರ್ಗೆಟ್ ಅನ್ನ ತಗೊಂಡಿರ್ತೀವಿ, ಇಷ್ಟು ಪೇಷಂಟ್ ಅಂತ ಹೇಳಿ. ಆ ಪೇಷಂಟ್ ನ ಎಲ್ಲಾ ಕೆಲಸಗಳನ್ನು ಕೂಡ ನಾವು ಮಾಡ್ತಾ ಇರ್ತೀವಿ. ಹವರ್ಲಿ ವೈಟಲ್ಸ್, ಮಾನಿಟರಿಂಗ್ಸ್ ಈ ತರದಾಗ್ಲಿ. ನಮಗೆ ಒಂದೊಂದ್ಸಲ ಕುತ್ಕೊಳೋದಕ್ಕೂ ಕೂಡ ಆಗೋದಿಲ್ಲ. ಸ್ವಲ್ಪ ರಿಲ್ಯಾಕ್ಸ್ ಮಾಡ್ಕೊಳೋಣ ಅಂತಂದ್ರೂ ಕುತ್ಕೊಳಕ್ಕೂ ಆಗೋದಿಲ್ಲ. ಆಮೇಲೆ ಕೆಲವೊಂದ್ಸಲ ತಂದಿದ್ದನ ಊಟನೂ ಕೂಡ ತಿನ್ಲಿಕ್ಕೂ ಕೂಡ ನಮಗೆ ಆಗೋದಿಲ್ಲ. ಸೊ ತಂದಿರೋ ಊಟನ ಎಷ್ಟೋ ಸಲ ತಿನ್ಲಿಕ್ಕೆ ಆಗ್ದೇನೆ ಅದು ಕೆಟ್ಟೋಗಿರುತ್ತೋ ಅಥವಾ ಇನ್ನ ತಿನ್ನಕ್ ಆಗಲ್ಲ ಅಂತ ಡಸ್ಟ್ಬಿನ್ಗೋ ಬಂದಿರೋ ಉದಾಹರಣೆಗಳು ಕೂಡ ಉಂಟು ಸರ್. ಹೀಗಾಗಿ ನಾವು ಅಲ್ಲಿ ಎಷ್ಟೋ ಗ್ಯಾಸ್ಟ್ರೈಟಿಸ್ ಸಮಸ್ಯೆಗಳನ್ನು ಕೂಡ ನಾವು ಬಂದಿರ್ತವೆ ನಮಗೆ ಕಾಂಟ್ರಿಬ್ಯೂಷನ್ ತರ. ಸೊ ಈ ತರದ ಒಂದು ಸಮಸ್ಯೆಗಳು ಹೆಲ್ತ್ ಈ ತರ ಊಟದ ವಿಷಯಗಳಲ್ಲಾಗ್ಲಿ ಈ ತರ ಊಟನೂ ಕೂಡ ನಾವು ತೊರಿಬೇಕಾಗುತ್ತೆ ಒಂದೊಂದ್ಸಲ. ಸೊ ಈ ತರ ಒಂದು ಸಮಸ್ಯೆಗಳು ಕೂಡ ಸಾಕಷ್ಟು ಇರುತ್ತೆ. ಮತ್ತೆ ಮೆಂಟಲಿ ಅಂತಂದ್ರೆ ಈಗ ನಮಗೆ ಆ ಪೇಷಂಟ್ ನ ನಾವು ನೋಡ್ಕೊಂತಾ ಇರ್ತೀವಿ. ಸೊ ಅಲ್ಲಿ ಕಾರ್ಪೊರೇಟರ್ ಹಾಸ್ಪಿಟಲ್ಗೆ ಎಲ್ಲಾ ಕೂಡ ಎಲ್ಲಾ ಕೆಲ್ಸ ಕೂಡ ಪಕ್ಕಾ ಆಗಿರ್ಬೇಕು. ಒಂದ್ ಕೆಲ್ಸ ಆಗಿಲ್ಲ ಅಂತಂದ್ರೆ ಸೊ ನೇರವಾಗಿ ಹೇಳ್ಬಿಡ್ತಾರೆ, ಬಿಟ್ಟೋಗ್ಬಿಡಿ, ಯಾಕೆ ಹೀಗ್ ಮಾಡ್ತೀರಾ, ಕೆಲ್ಸ ಮಾಡಕ್ ಆಗಿಲ್ಲ ಅಂದ್ರೆ ಬಿಟ್ಟೋಗ್ಬಿಡಿ ಅಂತ ಹೇಳ್ತಾರೆ. ಇದು ನಮಗೆ ನಿಜವಾಗಿ ಕೂಡ ಬಹಳ ಬೇಸರ ತರ್ತಕ್ಕಂತ ಒಂದು ವಿಷಯ. ಯಾಕೆಂದ್ರೆ ನಾವು ಎಷ್ಟೋ ಎಕನಾಮಿಕಲಿ ನಾವು ಒಂದೇನೋ ಸ್ಯಾಲ್ರಿಗೋಸ್ಕರನ ಅಥವಾ ಜೀವನ ಮಾಡ್ಲಿಕ್ಕೋಸ್ಕರನೋ ಹೋಗಿರ್ತೀವಿ. ಸೊ ಒಂದೇ ಸಲ ನಮಗೆ ಅವರು ಬಿಟ್ಟೋಗ್ಬಿಡಿ ಅಂತ ಒಂದೇನಾದ್ರು ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳನ್ನ ಕಂಡಾಗ ಬಿಟ್ಟೋಗ್ಬಿಡಿ ಅಂತ ಹೇಳಿದಾಗ ತುಂಬಾನೇ ಬೇಸರ ಕೂಡ ಅನ್ಸಿರೋದು ಕೂಡ ಉಂಟು. ಸೊ ಈ ತರ ಒಂದು ಮಾನಸಿಕ ಕಿರಿಕಿರಿಗಳನ್ನು ಕೂಡ ನಾವು ಅನುಭವಿಸಿದೀವಿ. ಜೊತೆಗೆ ಈ ತರ ಕಿರಿಕಿರಿಗಳು ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ನಮ್ಮ ಸ್ಟಾಫ್ಗಳ ಮಧ್ಯೆನೆ ಕೂಡ ಬಂದೋಗ್ಬಿಟ್ಟಿರುತ್ತೆ. ಎಷ್ಟೋ ಸಲ ಒತ್ತಡ, ಕೆಲಸದ ಒತ್ತಡದಿಂದಾಗಿ ಸ್ಟಾಫ್ಗಳಲ್ಲಿ ವೈಮನಸ್ಸುಗಳು ಕೂಡ ನಾವು ಬೆಳೆಸ್ಕೊಂಡ್ಬಿಟ್ಟಿರ್ತೀವಿ. ಸೊ ಹಾಗಾಗಿ ನಾವು ಇದ್ರ ಎಫೆಕ್ಟ್ ಕೂಡ ಪೇಷಂಟ್ಗಳ ಮೇಲೂ ಕೂಡ ನಮ್ಮ ಒಂದು ಕಿರಿಕಿರಿ ಪೇಷಂಟ್ಗಳ ಮೇಲೂ ಕೂಡ ಬಂದಿರುತ್ತೆ. ನಾವ್ ಎಷ್ಟೋ ಸಲ ಅವ್ರ ಜೊತೆ ಮಾತಾಡ್ಬೇಕಾದ್ರೆ ಮಾನವೀಯತೆನ ಕೂಡ ಕಳ್ಕೊಬೇಕಾಗುತ್ತೆ ಒಂದೊಂದ್ಸಲ ಕೆಲ್ಸದ ಒತ್ತಡದಿಂದ. ಕೆಲಸ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಇತ್ತು ಅಂದ್ರೆ ನಾವು ಕ್ಲೋಸ್ ಆಗಿ ಬಿಹೇವ್ ಮಾಡ್ತೀವಿ. ಒತ್ತಡ ಜಾಸ್ತಿ ಆದಾಗ ನಾವು ಅವ್ರ ಕಡೆಗೆ ಜಾಸ್ತಿ ಗಮನ ಕೊಡೋಕೆ ಆಗೋದಿಲ್ಲ. ಸೊ ಇಲ್ಲಿ ಪೇಷಂಟ್ ಏನಾದ್ರೂ ಕೂಡ ಎತ್ತಾದಾಗ್ಲೂ ಕೂಡ ನಮಗೆ ನಮ್ ಕೆಲ್ಸ ನಮಗೆ ಆಗ್ಬೇಕು ಫಸ್ಟ್. ಯಾಕೆಂದ್ರೆ ನಾವು ಆ ಕೆಲ್ಸ ನಾವು ಮುಗಿಸ್ಲೇಬೇಕಾಗಿರುತ್ತೆ. ಸೊ ಹಂಗಾಗಿ ಆ ಕೆಲ್ಸ ಆಗ್ಲಪ್ಪ, ನಮಗೆ ಬೇಗ ಆಗ್ಬೇಕು ಅಂತ ಹೇಳಿ ನಮಗೆ ಆ ಒಂದು ಪೇಷಂಟ್ ತೀರೋದಾಗ್ಲೂ ಕೂಡ ಆ ದುಃಖ ಅಂತಕ್ಕಂಥದ್ದು ನಮ್ಮನ್ನ ಎಲ್ಲೋ ಒಂದ್ ಕಡೆಗೆ ಕಣ್ಮರೆ ಆಗ್ಬಿಡುತ್ತೆ ನಮ್ಗೆ. ಸೊ ಹಂಗೆ ಮಾನವೀಯತೆನ ಕೂಡ ಕಳ್ಕೊಂಡು ಕೂಡ ಕೆಲ್ಸಗಳನ್ನ ನಾವು ಮಾಡಿರ್ತಕ್ಕಂತಹ ಉದಾಹರಣೆಗಳು ಉಂಟು. ಮಾಡೋ ತರನು ಕೂಡ ಮಾಡ್ಬಿಡುತ್ತೆ ಈ ICUಗಳಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಕ್ಕಂಥದ್ದು.
ಜ್ಯೋತಿ ಅವ್ರು ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರು. ಇದಕ್ಕೆ ನಾನು ಹೇಳ್ತಾ ಇದ್ದಿದ್ದು ಕಂಪ್ಯಾಷನ್ ಫಟೀಗ್ ಅಂತ. ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಆದಾಗ ಇನ್ನೊಬ್ರಿಗೆ ಮಾನವೀಯತೆಯನ್ನು ಕಳ್ಕೊಳ್ಳೋದು ಏನು ಅಂತ ಹೇಳ್ತೀವಿ. ದಟ್ ಇಸ್ ವಾಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಅಸ್ ಕಂಪ್ಯಾಷನ್ ಫಟೀಗ್. ನಮ್ಮ ಪ್ರೊಫೆಷನಲ್ಲಿ ಫ್ರೀಕ್ವೆಂಟ್ಲಿ ನಾವು ಬೇರೆಯವರಿಗೆ ಈ ತರ ಮಾನವೀಯತೆ ತೋರಿಸಿ there is a limit to be ಆ ಮಾನವೀಯತೆ ಆಗ್ಲಿ, ಕರುಣೆ ಆಗ್ಲಿ, ಇನ್ನೊಬ್ರ ಬಗ್ಗೆ ಎಂಪತಿ, ಅನುಭೂತಿ ಅಂತ, ಸಹಾನುಭೂತಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಅದನ್ನ ತೋರ್ಸೋದಕ್ಕೆ ಕಷ್ಟ ಆಗೋದಕ್ಕೆ ಕಂಪ್ಯಾಷನ್ ಫಟೀಗ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂಡ್ ಅದಲ್ಲದೆ ಅವ್ರು ಸುಮಾರು ವಿಷಯಗಳನ್ನ ಹೇಳಿದ್ರು. ಆರ್ಗನೈಸೇಷನ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ಸ್ಯಾಲ್ರಿ ಇರಬಹುದು, ಅಥವಾ ಅವರಿಗೆ ವ್ಯಾಲ್ಯೂ ಇಲ್ಲ ಅಂತ ಅನ್ನಿಸ್ತಾ ಇರೋದಿರಬಹುದು, ಅಥವಾ ಪರ್ಸನಲ್ ಲೆವೆಲ್ ಅಲ್ಲಿ ನಮ್ ಕೈಯಲ್ಲಿ ಆಗದೆ ಇರೋದ್ರಕ್ಕಿಂತ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ತಗೊಳ್ಳೋದಿರಬಹುದು, ಫಿಸಿಕಲಿ ಚಾಲೆಂಜಿಂಗ್, ಊಟ ನಿದ್ರೆ ಮಾಡದೆ ಕೆಲಸ ಮಾಡೋದಿರಬಹುದು. ಇವೆಲ್ಲವೂ ಬರ್ನೌಟಿಗೆ ಕಾರಣ ಅನ್ನೋದನ್ನ ಜ್ಯೋತಿ ಅವ್ರು ಹೇಳಿದ್ದಾರೆ. ತುಂಬಾ ಧನ್ಯವಾದ ಜ್ಯೋತಿ ಅವರೇ.
Hello.
Thank you, sir.
Once I think Dr. Hema has joined. Can you take over from here, or what shall we do?
Yes, I can take over now.
Yeah. Okay, right.
Now I request Dr. Ila. She is a PG assistant. If she can share her views, it will be good. Dr. Ila.
Hello.
Yes.
Yes, ma'am. Good evening, everyone. This is Dr. Ila, second year OBG PG in one of the government medical colleges, Karnataka. I don't want to disclose where I'm working, but overall agi postgraduate medical course in India adu ಎಷ್ಟು stressful irutte anta I just want to give a gist. And moreover medical faculty ge most of the time post graduation schedules hengirutte ಅಂತ ಗೊತ್ತಿರುತ್ತೆ. But I feel what is more important is public should know it. Like the normal people who come to us, patients agli, patient attenders agli, they should know our working hours. They should know the amount of work and the amount of pressure that we deal with. So adu that again the responsibility lies on us. Like namd ಕಷ್ಟಗಳನ್ನ ನಾವು ಹೇಳ್ಕೊಳ್ದೇ ಇದ್ರೆ ಅವ್ರಿಗೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಸೊ ಅವ್ರಿಗೆ ಒಂದೇ ಸತಿ ಬಂದಾಗ ಹೆಂಗ್ ಅನ್ಸುತ್ತೆ, most of the times ನಮ್ದು 24 ಅಥವಾ 36 hours ಶಿಫ್ಟ್ ಇರುತ್ತೆ. ಸೊ ನೈಟ್ ಡ್ಯೂಟಿನೂ ಕಂಟಿನ್ಯೂಸ್ ಮಾಡ್ಬೇಕು, ಮಾರ್ನಿಂಗ್ ಡ್ಯೂಟಿ, ನೈಟ್ ಡ್ಯೂಟಿ, ಅಂಡ್ ದ ನೆಕ್ಸ್ಟ್ ಡೇ ಅಗೇನ್ ಟಿಲ್ ಈವ್ನಿಂಗ್ ಡ್ಯೂಟೀಸ್ ಇರುತ್ತೆ. ಸೊ 36 hours ಕಂಟಿನ್ಯೂಸ್ ಡ್ಯೂಟಿಯಲ್ಲಿ ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ಸ್ ಸರ್ಜಿಕಲ್ ಬ್ರಾಂಚಸ್ ಅಲ್ಲಿ ಐ ಫೀಲ್ ದೇರ್ ವಿಲ್ ಬಿ ಮೋರ್ ಪ್ರೆಷರ್ ಕಂಪೇರ್ ಟು ಮೆಡಿಕಲ್ ಬ್ರಾಂಚಸ್. ಸೊ ದೇರ್ ಇಸ್ lot of physical work involved along with the mental work. And sir explain maditara, there are all symptoms present in any of the postgraduate candidates taken with the amount of work pressure. So burnout phenomena, I feel it's very common among every postgraduate. Our 36-hour shift like we see so many outpatient and we admit so many inpatient people, and we have to conduct deliveries, and at the same time we have to monitor, and we have to do procedures and sections, and again post procedure monitoring. It's really a continuous hectic process, and each one of it is very critical, and two lives are involved at same time. So we have to be more careful in monitoring, and at every step needs your complete concentration and attention, and it's humanly not possible for a single person to do it straight 36 or 48 hours. So adru jotege there'll be a lot of records and writing work, because every birth process needs to be documented, and there are so many other records and other writing work. So ಈ ತರ ಎಲ್ಲಾದ್ನೂ ಹ್ಯಾಂಡಲ್ ಮಾಡ್ಬೇಕಾದ್ರೆ at one time, as sir said, there will be physical burnout, mental burnout, emotional burnout. Even if ಯಾರೋ ಒಬ್ರು patient, because ನಮ್ಮ labor room is a very chaotic area. Sir explain ಮಾಡ್ದಂಗೆ it is overcrowded all the time, and it is always chaotic, and you have to take clinical decisions in those moments, and you have to be calm all the time. It is little extra to ask for a person who is like working in a market, banging his head. So that's how it will be here. So ಆ ತರ ಎಲ್ಲ situations ನ handle ಮಾಡ್ಬೇಕಾದ್ರೆ your empathy towards patient's labor pain just goes somewhere at back of your mind ಅಷ್ಟೇ. So you can't really respond to any labor pains of the patient also. And ಈ ತರ situations ಅಲ್ಲಿ when we behave in an abnormal way, in a way which we are not expected to behave, again that adversely affects our mental health, because nobody wants to treat a patient in bad way. But because of all these pressures that you're facing, at the end of the day, when you're not being empathetic towards patient, then you feel bad about yourself. That adds to the emotional baggage which is already present. So, and these instances are always there. It's like everyday process for us. Every day we feel fatigued at the end of the day, and every day there are instances where we just don't care about any of the patient complaints. We just want like those basic needs of those basic needs of ours for having food and sleep, that comes first sometimes, and that also can sometimes contribute to the errors in documentation, or sometimes the missing of medications or dosages. Still, though we don't want to do such things, but such things will happen. And like ಈಗ 2 years work ಮಾಡಿದ್ಮೇಲೆ I feel the root cause, or like some of the problems that lie there in the system. One, they can relax the working hours, like small working hours where everybody can contribute productively, and they can increase number of working hands. And if organized system is set up where preparedness is there for emergencies, handling emergency would become very much easy, because most of the times, since OBG is an emergency department, most of the times we feel postgraduates and interns would be ready to manage an emergency, but whereas it becomes difficult to train nursing staff or the workers to respond in the same way. So these are few things where if everyone is prepared for managing emergencies, it becomes easy for us when work is shared. So organizing work becomes very important, and increasing helping hands or working hands becomes very important. And I feel for any postgraduate across India, I feel that there has to be relaxation of working hours. There would be nobody who would finish NEET exam, sit for an year and do such a hard work and come to post graduation and not willing to work. I don't think there is even a single person in India who doesn't want to work in post graduation. Everybody wants to work, But if the timing is relaxed, the productivity increases is one of the things I really want to stress. So thank you so much for the opportunity. I can like go on and on with the problems and burnouts that we face every day. But like this is the gist I wanted to tell. Thank you.
Thank you, Ila, for your expressing your opinion. Already, whatever you have told, message also, probably she's a doctor, she has already written. Now we will, I request Dr. K.S. Gangadhar, he is a family physician for long, and to give his opinion as a practicing doctor. Dr. Gangadhar, please.
Hello. Hello, good evening, everybody. My topic actually, as a family physician, what type of burnout we have faced during these long years. That's just wanted to throw light on this subject with experience. Actually, I started as a family physician during early 80s and almost nearing 40 years now. And we have seen ups and downs in the patient's approach as well as our response to the patient's demands. And the other consequences of the other laws that is being imposed on the health scenario. I will not take much time actually. Within 3-4 minutes, I want to conclude actually. Initially with a jubilant, this thing we have started with a general practitioner in a lower middle class area as a family physician, and to establish ourselves as a family physician with rapport with the patients. It was a Herculean task. At the same time, they used to depend on us. The primary contact where the patients totally depend on the doctors. The primary doctor, who is known as a family physician, they take us everything for suggestion, every medical as well as otherwise, they will depend on the family physician. This has happened actually
Hello.
period between 80s and.
Vasudendra ಅವ್ರು ಕೇಳಬೇಕು.
Hello. Can you hear me? Hello. Okay, I will continue during 80s, and there is some amount of break when the Consumer Protection Act came into existence. This is the relation between doctors and patients to some extent. It became violated actually. The belief in doctors gave way actually. There is some amount of a doctor is a caregiver and I'm a patient. I'm expected to follow this instruction. I'm paying him and he is doing his responsibility as a doctor as he takes money. And this Consumer Protection Act in reality came into existence the help of the common man. But in reality, what has happened is it led to the defensive medical practice wherein the patients had to pay much more from their pocket, and we were forced to send patient to other investigations, unnecessary investigation. That has happened for a simple headache actually. MRI scanning used to, CT scanning, MRI scanning used to do. This is the first blow actually what we faced during the late 80s, and it went on like that. In spite of that, the patients belief in the family doctors, and it did not go in vain, and it only ಶಿಥಿಲ ಆಯ್ತದು, ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ಶಿಥಿಲ ಆಯ್ತು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ನಾನು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಅನುಭವಿಸಿದ್ದೀನಿ. ನಾನು ಅದನ್ನ ನೋಡಿದ್ದೀನಿ ಆ ತರ ಸಿಚುವೇಶನ್ ಅನ್ನ. ಆ ನಂತರದ ಇದರಲ್ಲಿ ನಾವು ಯಾವ ರೀತಿ ಜನರಲ್ ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲಿ ಇದ್ದಾಗ ಪೂರ್ತಿಯಾಗಿ ನಮ್ಮ ಟೈಮ್ ಅನ್ನ ವಿನಿಯೋಗಿಸ್ಬೇಕು. ಆಲ್ಮೋಸ್ಟ್ ಮಾರ್ನಿಂಗ್ ಸೆಷನ್ ಒಂದು, ಈವ್ನಿಂಗ್ ಸೆಷನ್ ಒಂದು, ಈ ತರ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಆ ತರ ಮಾಡಿದಾಗ ಯಾವ ರೀತಿ ನಾವು ಬೇರೆ ಅದಕ್ಕೂ ಟೈಮ್ ಕೊಡೋ ಇರುವಂತಹ ಒಂದು ವ್ಯವಸ್ಥೆ ಬರುತ್ತೆ. ನಾವು ಪಾಪ್ಯುಲರ್ ಪ್ರಾಕ್ಟಿಷನರ್ ಆದ್ರೆ ಇನ್ನೂ ಡೈಲಿ ಒಂದು 50-60 ಪೇಷಂಟ್, ಅದು ವೈರಲ್ ಸೀಸನ್ ಅಲ್ಲಿ ಜಾಸ್ತಿ ಪೇಷಂಟ್ ನೋಡುವಂಥದ್ದು, ಅದರಿಂದ ಸ್ಟ್ರೆಸ್ ಆಗೋದು, ಅದನ್ನು ನೋಡಿದ್ದೇವೆ. ಇದೊಂದು ಯಾಕಂದ್ರೆ ಪ್ರೈಮರಿ ಕೇರ್ ನಮ್ಮಲ್ಲಿ ತುಂಬಾ ಡಿಸ್ಟ್ರಿಬ್ಯೂಟ್ ಆಗಿಲ್ಲ, ಅದರಿಂದ ಈ ತರ ಆಗಿದೆ. ಅದು ನಮ್ಮ as a I'm not very popular that way, but usually I used to see 30-40 patients that way when viral infection was in peak. That was the situation. In the meantime, particularly in the 90s, we felt a little really feeling of annoyance with ourselves, a feel of dejection when insurance sector came in to the health sector, where corporate hospitals used to be there actually. And government hospitals also was there. When early 80s used to send patient for government hospital. At the same time, private small nursing homes used to send patient for acute abdomen diagnosis of appendicitis, appendicitis. And that it has about 10 times more. That is the repercussion of insurance sector came in being, and we are feeling helpless. When either you used to send hospital patients, we cannot, particularly the lower middle class patient or poor section cannot go to these big hospitals. Neither they do have insurance nor they do have afford to go to corporate hospitals, and we were forced to send them to government hospital. Though government hospital were catering to the needs of the common man, but there are problems of the government system, government hospital. As you know, the services are depleted because of the pressure of the patient load, as Dr. Ila told. That has happened actually during 90s and early 2000. And the bigger blow came during late, that is 2008, when the Clinical Establishment Act came, as though helping the common man. But rather it has put we solitary medical practitioner or family physician in a fix actually. So also small nursing homes were in a fix actually. And it created a tremendous pressure on doctors because of the fact that they have to abide by the KPME Act, some regulations, all these things. And we felt too much of stress during this period. Particularly now also we are going through the stress. It has become very this one to run the show. And ultimately I want to conclude with a note. ಏನಂತ ಹೇಳಿದ್ರೆ, ನಮ್ಗೇನೋ ವೈದ್ಯರಾಗಿ, ಫ್ಯಾಮಿಲಿ ಫಿಸಿಷಿಯನ್ ಆಗಿ, ಪ್ರೈಮರಿ ಕೇರ್ ಡಾಕ್ಟರ್ಸ್ ಆಗಿ ನಾವು ಸಾಮಾನ್ಯ ಜನತೆಗೆ, ರೋಗಿಗಳಿಗೆ ಏನು ನಾವು ಕೊಡಬಹುದು, ಅದನ್ನು ಮಾಡ್ಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ವಲ್ಲ ಅಂತ ಹೇಳೋ ಒಂದು ಹತಾಶೆ ಅಥವಾ ದುಃಖ ಆಗ್ತಾ ಇರುತ್ತೆ. ಇದನ್ನ ಮುಂದಿನ ವೈದ್ಯ ಸಮೂಹ ಅಡ್ರೆಸ್ ಮಾಡ್ತಾ ಅಂತ ಅನ್ಕೊಂಡಿದ್ದೀನಿ. ಇಷ್ಟು ಹೇಳಿ ನನ್ನ 2 ಮಾತನ್ನು ಮುಗಿಸ್ತೇನೆ. ಹಲೋ
ಹಲೋ.
ಚೆನ್ನಾಗಿ.
ಕ್ಲಿಯರ್.
Okay. Thanks, Dr. Gangadhar, for venting your feelings and emotions. Now I call upon Mr. Azaruddin Azar, pharmacist. Earlier he was a medical rep, and he is now a product manager to your company. Please share your opinion, Mr. Azaruddin.
Hello.
And let it be
Good
very
evening
brief,
to everyone.
2 or 3 minutes.
Hello. Good evening to everyone. Hello.
Hearing.
Yes, please do continue.
Okay. Can I talk in Kannada?
Yes, you can talk.
Yes. Okay. ಮತ್ತೆ ಈಗ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ಸು, ಫಿಸಿಕಲ್ ಸ್ಟ್ರೆಸ್ಸು ಮತ್ತೆ ಎಮೋಷನಲ್ ಸ್ಟ್ರೆಸ್. ಈ ತರ ಸ್ಟ್ರೆಸ್ ಅಂತ ಬಂದ್ರೆ ಆಸ್ ಎ ಫಾರ್ಮಸಿಸ್ಟ್ ಆಗಿ ಆಸ್ ಎ ಮೆಟೀರಿಯಲ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಗಿರ್ಬೋದು, ಇಲ್ಲ ಮೆಡಿಕಲ್ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಆಗಿರ್ಬೋದು. ಹಲೋ, ಆರ್ ಯು ಹಿಯರಿಂಗ್? ಹಲೋ.
ಹಿಯರಿಂಗ್.
ಓಕೆ.
ಬೇರೆಯವರೆಲ್ಲ ಸಹ ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ.
Please mute yourself other than the speaker.
ಆಸ್ ಎ ಮೆಡಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ನರ್ ಆಗಿ ಒಂದು ಮೆಡಿಕಲ್ ಪ್ರಾಕ್ಟೀಸ್ನರ್ಗೆ ಎಲ್ಲಾ ತರದ ಒಂದು ಪ್ರೆಷರ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಇವನ್ ಮೆಂಟಲ್ ಆಗಿರ್ಬೋದು, ಫಿಸಿಕಲ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಯಾವುದೇ ಒಂದು ಫಿಸಿಕಲ್ ಮತ್ತೆ ಹಲೋ ಹಲೋ
ಕಂಟಿನ್ಯೂ ಮಾಡಿ ಸರ್, ಕಂಟಿನ್ಯೂ ಮಾಡಿ.
ಡಿಸ್ಟರ್ಬೆನ್ಸ್ ಇದೆ.
ಕಂಟಿನ್ಯೂ ಮಾಡಿ ಮಿಸ್ಟರ್ ಅಜರುದ್ದೀನ್, ಕಂಟಿನ್ಯೂ ಮಾಡಿ.
ಓಕೆ. ಸ್ಟ್ರೆಸ್ ಅಂತ ಬಂದ್ರೆ ಇವನ್ ಎಲ್ಲಾ ಒಂದು ವರ್ಗದಲ್ಲಿ ಸ್ಟ್ರೆಸ್ ಇರುತ್ತೆ. ಒಂದು ಯಾವುದೇ ತರ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಹಾಸ್ಪಿಟಲ್ ಫಾರ್ಮಸಿಸ್ಟ್ ಆಗಿರ್ಬೋದು, ಇಲ್ಲ ಕ್ಲಿನಿಕಲ್ ಫಾರ್ಮಸಿಸ್ಟ್ ಆಗಿರ್ಬೋದು. ಅಂದ್ರೆ ಅದು ಇವನ್ ಇದು ಬಿಗ್ ಸ್ಕೇಲ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಆಗಿರ್ಬೋದು, ಲೈಕ್ ಕಾರ್ಪೊರೇಟ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಲ್ಲಿ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಒಂದು ಸಣ್ಣ ಕ್ಲಿನಿಕ್ ಅಂದ್ರು ಅದರದ್ದೇ ಆದಂತ ಒಂದು ಪ್ರೆಷರ್ ಅಂತ ಇರುತ್ತೆ. ಹೌ ಕ್ಯಾನ್ ವಿ ಸಾಲ್ವ್ ಅಂದ್ರೆ ಅದನ್ನ ಪ್ರೆಷರ್ನ ಯಾವ ತರ ನಾವು ಕಡಿಮೆ ಮಾಡ್ಕೋಬೇಕಂದ್ರೆ, ಒಂದು ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಒಂದು ವರ್ಕ್ ಕೋಆರ್ಡಿನೇಷನ್ ಆಗಿರ್ಬೋದು, ವರ್ಕ್ ಡಿಸ್ಟ್ರಿಬ್ಯೂಷನ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ನಾವು ಯಾವ ತರ ಶಿಫ್ಟ್ ವೈಸ್ ಅದನ್ನ ಆಲ್ಟರ್ನೇಟಿವ್ ಆಗಿ ಮಾಡೋದಾಗಿರ್ಬೋದು, ಅಥವಾ ಅದನ್ನ ಯಾವ್ದೇ ತರ ನಾವೊಂದು ನ್ಯೂ ಮೆಥಡಾಲಜಿನ ಯೂಸ್ ಮಾಡಿ ಆಗಿರ್ಬೋದು, ನಾವು ಅಡಾಪ್ಟ್ ಮಾಡ್ಕೊಂಡು ಅದೇ ಸ್ಟ್ರೆಸ್ ನ ನಾವು ಕಡಿಮೆ ಮಾಡ್ಕೋಬೇಕಾಗುತ್ತೆ. ಇವನ್ ಒಂದು ಕಾರ್ಪೊರೇಟ್ ಹಾಸ್ಪಿಟಲ್ ಅಂತ ಬಂದ್ರೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಅಲ್ಲಿ ದೊಡ್ಡ ಸ್ಕೇಲ್ ಅಲ್ಲಿ ಇನ್ವೆಂಟ್ರಿ ಇರುತ್ತೆ. ಅಲ್ಲಿ ತುಂಬಾ ಪೇಷಂಟ್ ಬರೋಂತ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. ಆ ತರದಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ರೆಸ್ಟ್ಲೆಸ್ ವರ್ಕ್ ಇರುತ್ತೆ. ಅಲ್ಲಿ 8 to 9 ಅವರ್ ಮಿನಿಮಮ್ ಆಗಿ ವರ್ಕ್ ಮಾಡ್ಲೇಬೇಕಾಗುತ್ತೆ. ಇವನ್ನೇ ಒಂದು ಎಂಪ್ಲಾಯ್ ಆದ್ರೂ ಕೂಡ ಅಲ್ಲಿ ಅವ್ರಿಗೆ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಪರ್ಸನಲಿ ಟೈಮ್ ಕೊಡ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಅಲ್ಲಿ ವರ್ಕ್ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ತುಂಬಾ ಪ್ರೆಷರ್ ಆಗಿರುತ್ತೆ. ಇವನ್ ಅವ್ರಿಗೆ ರೆಸ್ಟ್ ಕೂಡ ಇರೋದಿಲ್ಲ. ಲೈಕ್ 8 to 9 ಅವರ್ಸ್ ಅವ್ರಿಗೆ ರೆಸ್ಟ್ ಅಂತೂ ಇರೋದೇ ಇಲ್ಲ. ಅಲ್ಲಿ ಕೂಡ ಇವನ್ ಫಿಸಿಕಲ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಯಾವುದೇ ಒಂದು ಸಿಸ್ಟಮೆಟಿಕ್ ವರ್ಕ್ ಎಲ್ಲ ನಡೀತಾ ಇರುತ್ತೆ. ಅಂದ್ರೆ ಅಲ್ಲಿ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ ಕೂಡ ತುಂಬಾನೇ ಇರುತ್ತೆ ಅವ್ರಿಗೆ. ಈ ತರ ಅವ್ರಿಗೆ ಅಲ್ಲಿ ಮೀನ್ಸ್ ಸ್ಟ್ರೆಸ್ ಒಂದು ಉಂಟಾಗುತ್ತೆ. ಮತ್ತೆ ಅದನ್ನ ಬಿಟ್ಟು ಒಂದು ಮೆಡಿಕಲ್ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಅಂತ ಬಂದ್ರೆ, ಅವ್ರಿಗೆ ಆದಂತ ಕೆಲವೊಂದು ರೂಲ್ಸ್ ಅಂಡ್ ರೆಗ್ಯುಲೇಷನ್ಸ್ ಇರುತ್ತೆ, ಕೆಲವೊಂದು ಪ್ರೋಟೋಕಾಲ್ಸ್ ಅಂತ ಇರುತ್ತೆ. ಅದಕ್ಕೆ ಅವರು ಅಡ್ಜಸ್ಟ್ ಆಗಿ ನಾವು ವರ್ಕ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ನಾವಾದ್ರೆ ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಇಷ್ಟು ಮೆಡಿಸಿನ್ ನ ನಾವು ಸೇಲ್ ಮಾಡ್ಬೇಕಂತ ಆಗಿರ್ಬೋದು, ಇಷ್ಟು ಟಾರ್ಗೆಟ್ ಅಂತ ಕೊಟ್ಟಿರೋದಾಗಿರ್ಬೋದು. ಆತರ ಕೆಲವೊಂದೆಲ್ಲ ಅವ್ರಿಗೆ ಒಂದು ಪ್ರೋಟೋಕಾಲ್ಸ್ ಅಂತ ಇರುತ್ತೆ ಅವ್ರದೇ ಆದಂತ. ಇವನ್ ಫಾರ್ಮಸಿಸ್ಟ್ ಆದ್ರೆ ಅವ್ರಿಗೆ ಇಷ್ಟು ನಿಂದ್ ವರ್ಕ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ ಅಂತ ಇರುತ್ತೆ. ಇವನ್ ಒಂದು ಡಾಟಾ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಗಿರ್ಬೋದು, ಒಂದು ಡಿಸ್ಪೆನ್ಸಿಂಗ್ ಅಂತ ಆಗಿರ್ಬೋದು, ಒಂದು ಬಿಲ್ಲಿಂಗ್ ಅಂತ ಆಗಿರ್ಬೋದು. ಮೀನ್ಸ್ ಲೈಕ್ ಅದು ಅದರದ್ದೇ ಆದಂತ ಒಂದು ಕೆಲವೊಂದು ವರ್ಕ್ ರೂಲ್ಸ್ ಗಳು ಇರುತ್ತೆ. ಒಂದು ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಅಂತ ಬಂದ್ರೆ ಅವನಿಗೆ ಆದಂತ ಒಂದು ಟಾರ್ಗೆಟ್ ಅಂತ ಕೊಟ್ಟಿರ್ತಾರೆ. ಈ ಮೆಡಿಸಿನ್ ನ ಇಷ್ಟು ಸೇಲ್ ಮಾಡ್ಬೇಕು, ಇಷ್ಟು ಜನಕ್ಕೆ ನಮ್ ಪ್ರಾಡಕ್ಟ್ ನ ತಲುಪಿಸ್ಬೇಕು, ಅದ್ರ ಬಗ್ಗೆ ಇಷ್ಟು ಜನಕ್ಕೆ ನಾವು ಹೇಳ್ಬೇಕಂತ ಅವ್ರಿಗೆ ಆದಂತ ಒಂದು ರೋಲ್ ನ ಕೊಟ್ಟಿರ್ತಾರೆ. ಅವರ ಹೈಯರ್ ಆಫೀಸರ್ಸ್ ಯಾರು ಇರ್ತಾರೋ ಅವ್ರ ಅಂಡರ್ ಅಲ್ಲಿ ಅವ್ರು ಏನು ಅವ್ರಿಗೆ ಟೀಚ್ ಮಾಡ್ತಾರೋ ಅದೇ ತರ ಇವರು ಕೂಡ ವರ್ಕ್ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ. ಇವನ್ ಕೆಲವೊಂದು ಟೈಮ್ ಅಲ್ಲಿ ಅದು ಪ್ರಾಪರ್ ಆಗಿ ಅವ್ರ ವರ್ಕ್ ರನ್ ಆಗ್ತಾ ಇರಲ್ಲ. ಇವನ್ ಅವ್ರದ್ದು ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ ಇದ್ದಾಗಿರ್ಬೋದು, ಪರ್ಸನಲ್ ಫ್ಯಾಮಿಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದಾಗಿರ್ಬೋದು, ಏನೋ ಒಂದು ಪರ್ಸನಲ್ ಇಶ್ಯೂಸ್ ಇದ್ದ ಆವಾಗ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಇವನ್ ಅವ್ರಿಗೆ ಮೆಂಟಲಿ ಕೂಡ ತುಂಬಾ ಸ್ಟ್ರೆಸ್ ಆಗುತ್ತೆ, ಫಿಸಿಕಲಿನೂ ಸ್ಟ್ರೆಸ್ ಆಗುತ್ತೆ. ಯಾಕಂದ್ರೆ ಅವರು ಪ್ರಾಪರ್ ಆಗಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ ಒಂದೇ ಸಾರಿ ಹೆವಿ ವರ್ಕ್ ಬಿಟ್ಕೊಂಡಾಗ ಅದನ್ನ ಇವಾಗ 3 days ಅಲ್ಲಿ ಕಂಪ್ಲೀಟ್ ಮಾಡ್ಬೇಕಂತ ಅವ್ರ ಹೈಯರ್ ಆಫೀಸರ್ಸ್ ಹೇಳ್ತಾರೆ. ಅವ್ರು 1 ತಿಂಗಳು ಮಾಡೋ ಕೆಲಸ 3 days ಕೊಟ್ಟಾಗ ಅವ್ರಿಗೆ ಅದು ತುಂಬಾನೇ ಸ್ಟ್ರೆಸ್ ಆಗುತ್ತೆ. ಇವನ್ ಅದಕ್ಕೆ ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ ಅಂತ ಹೇಳ್ಬೋದು ನಾವು. ಮೆಂಟಲಿ ತುಂಬಾ ಸ್ಟ್ರೆಸ್ ತಗೊಂಡು 1 month ಮಾಡೋ ಕೆಲಸ 3 days ಗೆ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಈ ತರ ಆಗಿರ್ಬೋದು. ಮತ್ತೆ ಆಸ್ ಎ ಫಾರ್ಮಸಿಸ್ಟ್ ಅಂತ ಬಂದ್ರೆ ಅವ್ರಿಗೆ ಕೆಲವೊಂದು ಡಾಕ್ಯುಮೆಂಟೇಶನ್ ಇಂದು ಸ್ಟ್ರೆಸ್. ಒಂದು ಡ್ರಗ್ ಒಂದು ಇನ್ವೆಂಟರಿ ಮ್ಯಾನೇಜ್ ಮಾಡೋದಾಗಿರ್ಬೋದು, ಬೌನ್ಸ್ ಲಿಸ್ಟ್ ಅಂತ ಬರುತ್ತೆ, ಅದನ್ನ ಮ್ಯಾನೇಜ್ ಮಾಡೋದಾಗಿರ್ಬೋದು, ಒಂದು ಎಕ್ಸ್ಪೈರ್ಡ್ ಐಟಮ್ಸ್ ನ ಲಿಸ್ಟ್ ಮಾಡೋದಾಗಿರ್ಬೋದು. ಎಲ್ಲಾ ತರದಲ್ಲಿ ಇವನ್ನೇ ಫಾರ್ಮಸಿಸ್ಟ್ ಅಂದ್ರೆ ಅವನಿಗೆ ಆದಂತ ಒಂದು ಸ್ಟ್ರೆಸ್ ಇರುತ್ತೆ. ಯಾವುದೇ ಒಂದು ಡಾಕ್ಯುಮೆಂಟೇಶನ್ ಮಾಡೋದಾಗಿರ್ಬೋದು, ವರ್ಕ್ ಅಲ್ಲಿ ಪ್ರಾಪರ್ ವರ್ಕಿಂಗ್ ರನ್ ಆಗ್ತಾ ಇದೆನೋ ಇಲ್ವೋ ಅಂತ ಚೆಕ್ ಮಾಡೋದಾಗಿರ್ಬೋದು, ಈ ತರ ಎಲ್ಲ ಸ್ಟ್ರೆಸ್ಸಸ್ ಇರುತ್ತೆ ಫಾರ್ಮಸಿಸ್ಟ್ ಆದ್ರೆ. ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಆದ್ರೆ ಮೊದ್ಲೇ ಹೇಳಿದ ತರ ಅವನ್ಗೆ ಒಂದು ಗೋಲು, ಒಂದು ಟಾರ್ಗೆಟ್ ಅಂತ ಕೊಟ್ಟಿರ್ತಾರೆ, ಅದನ್ನ ರೀಚ್ ಮಾಡ್ಲಿಕ್ಕಾಗಿನೇ ಅವ್ನ್ ತುಂಬಾ ಸ್ಟ್ರೆಸ್ ತಗೋಬೇಕಾಗುತ್ತೆ. ಬೈ ಮೀನ್ಸ್ ಇದನ್ನ ನಾವು ಕಡಿಮೆ ಮಾಡ್ಕೋಬೇಕಂದ್ರೆ ನಾನ್ ಮೊದ್ಲೇ ಹೇಳಿದ ತರ ಒಂದು ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಗಿರ್ಬೋದು, ಒಂದು ಅದರ್ ಸ್ಟಾಫ್ಸ್ ಜೊತೆ ಕೋಆರ್ಡಿನೇಷನ್ ಚೆನ್ನಾಗಿದ್ದು, ಸಮ್ ಏನಂದ್ರೆ ಸೈಂಟಿಫಿಕ್ ಮೆಥಡ್ಸ್ ನ ಯೂಸ್ ಮಾಡಿ ನಾವು ಕಡಿಮೆ ಮಾಡ್ಕೋಬಹುದಾಗಿದೆ. ಈ ತರ ಎಲ್ಲ ನಾವು ಸ್ಟ್ರೆಸ್ ನ ಕಡಿಮೆ ಮಾಡಬಹುದು. ಬಟ್ ಮೋಸ್ಟ್ ಆಫ್ ಆಲ್ ನಾನು ಏನ್ ಹೇಳಿದ್ನಲ್ಲ, ಇದೇ ತರ ಸ್ಟ್ರೆಸ್ ಆಲ್ಮೋಸ್ಟ್ ಎಲ್ಲಾ ಎಂಪ್ಲಾಯೀಸ್ಗೂ ಒಂದು ರಿಸ್ಕಿ ಫ್ಯಾಕ್ಟರ್ ಅಂದ್ರೆ ಇದೇ ತರ ಸ್ಟ್ರೆಸ್ಸಸ್, ಮೆಂಟಲಿ ಫಿಸಿಕಲಿ ಆಗಿರ್ಬೋದು. ಬಿಟ್ರೆ ಬೇರೆ ಏನ್ ಆಗಲ್ಲ ಅನ್ಕೋತೀನಿ.
Okay, thank you, Azaruddin, for expressing your views.
Okay. Thank you,
Now,
ma'am.
okay, now I request anyone from the audience to speak very briefly if any issue you have or whatever your reflection on this point.
Good evening, ma'am. Myself, Dr. Ganesh. The stress and all psychiatric illness in medical students or any health workers is mainly because of work burden. How can we prevent this? Like we can approximately we should estimate how many students or how many residents should be needed for the hospital to run throughout the day. That kind of estimation should be sent to government or higher authorities to allot that many numbers of residents for the work. So work distribution, if it is proper, there will not be any stress. And one more thing is good psychiatrist or counselor should be there to counsel or to screen the psychiatric illness or emotional stress among the health workers. That would be better option.
Okay, anybody is ready to speak for a few minutes? Please share your opinions.
Hello.
Yes, please introduce yourself and speak.
Okay, I am Varsha, final year medical student from Davangere, and actually I am a sister of Dr. Ila, who just spoke a few minutes ago, and everything she has explained, I just want to share my view in this situation. Since I am a final year medical student, and since I am seeing my sister go through so much of difficulty on a everyday and day-to-day basis, I feel, do I really need to take up my post graduation after I complete my MBBS? Isn't just MBBS graduation enough? That is one of the questions I face on an everyday basis. And even of course the time demands for us to do our post graduation and move forward in our career. Even so, then how do you overcome these problems which my sister is facing, and how can I overcome these problems in my coming days is the question I have on a day-to-day basis. And also it is very demotivating to listen to these stories as a student. As a final year MBBS student, I find it demotivating to join any postgraduate course. I would really like an explanation from Dr. Dhruva sir on this point of view. Thank you.
Okay, now I request any one from the audience, and later on I request Dr. Dhruva Aithal to take over and give solutions or remedies or remedial measure, whatever it is. Dr. Lakshman was supposed to be here. If he is there, I request him. Otherwise, we'll have last speaker who like to speak his opinion.
Hello, Dr. Vasudendra here.
Yes.
Yes. Yeah, it was a wonderful discussion. I had this topic in my mind since long. So as I could understand from a presentation of Dr. Dhruva, and also on observing people, the working situation, and listening to the experiences of people here and before also, I think it's mainly because of two things. I think Dr. Dhruva can correct. One thing is, as I said, the problems, day-to-day problems faced by the health worker. That is one thing. And secondly, the external system. I mean to say, as Dr. Ganesh told, Ila told, the work hours, the pressures, and I think they can be solved. It's not just the individual trait that is solely responsible. Even the environment, work culture, work pressures, and policies, and as Dr. Gangadhar told, this KPME or Consumer Protection Act, all these things can add to the this, and a newer culture of target oriented approach for the doctors to generate more revenue. All these things, and job insecurity nowadays, many people who are coming out, they have job which they may not like, but they don't have enough opportunity to leave the job and to join another one, because there is a scarcity of jobs. So probably so many factors contribute to the existing conditions. And another aspect is, because of COVID pandemic, this situation has worsened, and women particularly are more affected. That is one aspect which I think audience and Dr. Dhruva can agree. So this phenomenon, which was there probably, I don't know, in Western countries, and has now increased in Indian scenario, and youngsters particularly are being affected more, as testimonials of Dr. Ganesh or Swati, who wrote in her comment section. So PGs, ICU staff, medical representatives, many people who are working in health field are affected by this job burnout, and we have to seriously think about, because it is not only the individual's health, but it is the health of the patients or health of the society at large is at question, may be affected. So I think this is an important topic. This is what I personally think about this issue. Thank you.
May I say something? I just wanted to say, shall I?
Okay.
Yes, please do.
No, one thing what I feel is, we enter into the profession with service mind and take this profession as a soul and whole. So because of that, we get so much engaged, and also we take the problems of the patient as our own many times. We are not able to maintain a distance. So that also causes a lot of stress, I feel. And apart from that, I think we should give some time for other activities also. Whatever habits or whatever for recreation or whatever, either reading or cultural program or trekking, whatever it is. So we give some space for that. Probably that will be stress bursting, and it will help us to rejuvenate. So I want a take of Dr. Dhruva on this. Thank you.
Thank you, Dr. Sudha, for venting with your opinions. There are many points which have come told by many of the doctors and as well as other health professionals. What I feel is Dr. Dhruva can deal all these things and give solution, whatever can be. And especially the point of moral distress that has already come, and women being affected, and during the time of pandemic or disaster, the problem of burnout or job insecurity, and as such uncertainty of life in the entire society, and corporatization. Probably all these things are the responsible factor, apart from intrinsic problem of an individual being not able to express himself, not able to be assertive, all such things. So I request Dr. Dhruva Aithal to take over and speak on these things.
Thank you so much, ma'am. It has been a wonderful evening with so many new points coming up for discussion, and then everyone brainstorming and then suggesting ideas. I don't know whether I can keep up to the expectation of the audience to give solution to most of the problems that have been illustrated. I would like to be the host again so that I can have few of my slides again, if that is possible. But in the meanwhile,
Varsha,
I would...
please make him the host. Varsha?
Yes, ma'am. 1 second.
Okay. Many points have been discussed, and I totally agree, as Dr. Vasudendra already summarized, that burnout or stress happens because of not just the individual factor, but also because of what we call as organizational factors, which people said it is working hours, corporate setup, PG life, which are beyond us to control. Say, it is what is expected in that particular role, in that particular period of time of your life, which are beyond our control. I would like to come back to everything that everyone said, and then I would like to have some time for final discussions after my slides. ಯಾವುದೇ problem idru, I think mixing the language is better because there are all the kind of people. ಯಾವುದೇ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರು ಕೋಪಿಂಗ್ ಕ್ಯಾನ್ ಬಿ ಬೆಟರ್ ಯಾವಾಗ ನಾವು ಈ ಎರಡು ಮೆಥಡ್ಸ್ ಅನ್ನ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಎಲ್ಲಾ ಕೋಪಿಂಗು ಅಂದ್ರೆ ಪ್ರಾಬ್ಲಮ್ ಅನ್ನು ಫೇಸ್ ಮಾಡೋದು ಎರಡ್ ತರ ಇರುತ್ತೆ. ಒಂದು ಪ್ರಾಬ್ಲಮ್ ಬೇಸ್ಡ್ ಕೋಪಿಂಗ್, ಇನ್ನೊಂದು ಎಮೋಷನಲ್ ಬೇಸ್ಡ್ ಕೋಪಿಂಗ್ ಅಂತ. ಪ್ರಾಬ್ಲಮ್ ಬೇಸ್ಡ್ ಅಂದ್ರೆ ಹೇಗೆ ಅಂದ್ರೆ, ವೆನ್ ಆ ಪ್ರಾಬ್ಲಮ್ಗೆ ಸೊಲ್ಯೂಷನ್ ಸಾಧ್ಯ ಅಂದಾಗ, ಹೆಚ್ಚಿನ ವಿಷಯ ನಮ್ಮ ಸಂದರ್ಭದಲ್ಲಿ ಬಂದಾಗ, ಕಾರ್ಪೊರೇಟ್ ಸೆಟಪ್ ಇರಬಹುದು, ಗಂಗಾಧರ್ ಅವ್ರು ಹೇಳಿದಾಗೆ ಇನ್ಶೂರೆನ್ಸ್ ಸಿಸ್ಟಮ್ ಬಂತು, 87 ಅಲ್ಲಿ ಬಂದಿರೋ ಸಿಸ್ಟಮ್ ಇರ್ಬೋದು, ಅವೆಲ್ಲ ನಮ್ಮ ರೀಚಿಗೆ ಬಿಯಾಂಡ್. ಹೆಚ್ಚಿನ PG ಸ್ಟೂಡೆಂಟ್ಸ್ ರಿಕ್ರೂಟ್ ಮಾಡ್ಕೊಳ್ಳೋದಿರ್ಬಹುದು, ಸ್ಟಾಫ್ ಅನ್ನು ಇನ್ಕ್ರೀಸ್ ಮಾಡೋದಿರ್ಬಹುದು, ಅವಕ್ಕೆಲ್ಲ ವಿ ಕ್ಯಾನ್ ನಾಟ್ ಡೂ ಎನಿಥಿಂಗ್ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಟು ಚೇಂಜ್ ದೆಮ್. ಸೊ ಇನ್ ವಿಚ್ ಕೇಸ್, ವೆನ್ there is no way how we can change the problem, then we can focus on emotion focused coping. ಬಟ್ ಪ್ರಾಬ್ಲಮ್ಗೆ, ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಮೆಡಿಕಲ್ ಹೆಲ್ತ್ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ಗೆ ಸಮಸ್ಯೆ ಸಾಧ್ಯ ಇಲ್ಲ ಅಂತ ಖಂಡಿತ ಇಲ್ಲ. ವಿ ಆರ್ ನಾಟ್ ಡೆಫಿನೆಟ್ಲಿ ಇನ್ ಎ ಸ್ಟೇಜ್, ವರ್ಷ ಹೇಳ್ದಂಗೆ ಡಿಮಾರಲೈಸ್ ಆಗೋ ಸ್ಥಿತಿನಲ್ಲಿ ನಾವು ಖಂಡಿತ ಬಂದಿಲ್ಲ. Postgraduate period is very stressful, I agree, but it is also time limiting. Initial 1 or 2 years when it is difficult, ಅವಾಗಷ್ಟೇ ಈ ಸಮಸ್ಯೆಗಳು ಬರುತ್ತೆ. ಬಟ್ ಇದು ಜೀವನ ಪರ್ಯಂತ ಆಗೋದಲ್ಲ. ಬಟ್ ಅವಾಗ್ಲೂ ಇದನ್ನ ಫೇಸ್ ಮಾಡಬಹುದು, ಸಮಸ್ಯೆ ಆಗದೆ ಇರೋ ಹಾಗೆ ತಡ್ಕೋಬಹುದು. ಅಂಡ್ ವಿ ಕ್ಯಾನ್ ಪ್ರಿವೆಂಟ್ ಇಟ್, ವಿಚ್ ಐ ಆಮ್ ಗೋಯಿಂಗ್ ಟು ಡೀಲ್ ವಿತ್. ಅಂಡ್ ಈವನ್ ಕಾರ್ಪೊರೇಟ್ ಸೆಟಪ್ ಅಲ್ಲಿ ಆಗಿರಬಹುದು, ಏನಾದ್ರೂ ಆಗಿರಬಹುದು, being united, bringing forward our concerns and letting the management know, letting the government know, letting change happen at the society at a bigger level is one way of coping with the stress that we face as medical profession. Second, and the most important and the easiest thing is focusing inwards. Internally ನಾವು ಏನ್ ಮಾಡಬಹುದು, ಯಾವ್ದ್ರಿಂದ ನಾವು ಇವುಗಳನ್ನ ಬೆಟರ್ ಆಗಿ ಡೀಲ್ ಮಾಡಬಹುದು ಅಂತ. I will go into details of each exercise, taking bath, giving yourself pep talk, meditation, anything and everything. ಎಲ್ಲಿ ನಿಮ್ಗೆ ವೆಂಟಿಲೇಷನ್ ಸಿಗುತ್ತೆ. ಫ್ರಸ್ಟ್ರೇಷನ್ ಅನ್ನೋದೇನಿದೆ, ಇಟ್ ಇಸ್ ಲೈಕ್ ಎ ವೆಸಲ್, ಆಗ್ತಾ ಹೋಗುತ್ತೆ. ಅನ್ಲೆಸ್ ನೀವು ಅದನ್ನ ಖಾಲಿ ಮಾಡ್ಲಿಲ್ಲ ಅಂತಂದ್ರೆ ತುಂಬಿ ತುಳ್ಕೋಕ್ ಶುರು ಆಗುತ್ತೆ. ಖಾಲಿ ಮಾಡೋದಕ್ಕೆ ಒಬ್ಬೊಬ್ರಿಗೆ ಒಂದೊಂದು ವಿಧರ ಹಾಯ್ ಅನ್ಸ್ಬಹುದು. ಇನ್ ಫಾರ್ ಯು, ಐ ಥಿಂಕ್ ಯು ಶುಡ್ ಫಾಲೋ ದಟ್. Burnout ಅಲ್ಲಿ importantly, management ಅಂದ್ರೆ like many other mental health disorders, primary, secondary, tertiary. Primary is when we can prevent it altogether. We can find out the at-risk population, and then and that is what we are doing today. We medical health professionals, we are at risk, are trying to be aware of this phenomena, burnout and stress and so that having a knowledge can help us identify this at the beginning and seek help. And prevention can also be from the organizational front. I think Priyanka ಅವರು ಮ್ಯೂಟ್ ಮಾಡ್ಕೋಬೇಕು, ಇಲ್ಲಾಂದ್ರೆ ಎಲ್ರಿಗೂ ಡಿಸ್ಟರ್ಬ್ ಆಗುತ್ತೆ. ಪ್ರಿಯಾಂಕಾ ಅವರ, ಪ್ರಿಯಾಂಕಾ, I am sorry, I have
Dr. Priyanka, please mute yourself.
ಹೆಚ್ಚಿನ ಜನ ಅನ್ಮ್ಯೂಟ್ ಆಗಿದ್ದಾರೆ ಅಂತ.
Varsha, I think you can mute every one of them. Varsha, you can mute everyone. It's creating.
Hello, ma'am. Since Dhruva sir is host now, he can mute everyone.
Okay. Sir, please mute everyone.
Ma'am, Dhruva sir can do that. I can no longer do it because he is the host.
Okay, I have made you the host again, Varsha. I will continue to present. I think you can mute all of them because it is difficult for me to manage both. Thank you so much. So I'll continue. The primary prevention can also happen at an organizational level. ಹೆಚ್ಚಿನ ಜನ ಇದ್ರ ಬಗ್ಗೆ ಹೇಳ್ತಾ ಇದ್ರಿ. At the system level, there needs to be a change. ಈ ತರ ಮಾತಾಗ್ತಾ ಇರೋದ್ರಿಂದ, ಕಾನ್ವರ್ಸೇಷನ್ಸ್ ಆಗ್ತಾ ಇರೋದ್ರಿಂದ I hope that will happen sooner. ಇವತ್ತು ನಾನು particularly ಏನ್ ಫೋಕಸ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಅಂದ್ರೆ at an individual level, how can we deal with it? Even when PG life is going to be stressful, ನಾನು ಏನ್ ಮಾಡಿದ್ರೆ ಅದನ್ನ ಬೆಟರ್ ಆಗಿ ಡೀಲ್ ಮಾಡಬಹುದು ಅಂತ. Importantly, burnout ಅನ್ನು ಡೀಲ್ ಮಾಡೋದ್ರಲ್ಲಿ ವರ್ಕ್ ಲೋಡ್. Most of the times it is unmanageable beyond us. ನಮ್ಮ ಹತ್ರ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಇರಲ್ಲ. Reward, again, something for the organization to decide. Salary ಕಮ್ಮಿ ಸ್ಯಾಲರಿ ನಲ್ಲಿ ವರ್ಕ್ ಮಾಡಿ ಅಂತ ಹೇಳೋದಿರಬಹುದು, ಅಥವಾ ಜಾಸ್ತಿ ಸಮಯ ವರ್ಕ್ ಮಾಡಿ ಅಂತ ಹೇಳೋದಿರಬಹುದು, ಕೆಲಸ ಮಾಡಿದ್ದಕ್ಕೆ ಸರಿಯಾದ ರಿವಾರ್ಡ್ ಕೊಡೋದೇ ಇರಬಹುದು. ಅದನ್ನ we should definitely change. Community, that is what we are doing today. We are coming together as a community to share, to brainstorm, come with solutions for these problems. Ask for fairness. Ila ಅವರು ಹೇಳಿದಿರಬಹುದು, ಸುಧಾ ಅವರು ಹೇಳಿದ್ರು. There is an undue request from the medical healthcare professionals. ಜನ ದೇವ್ರು ಅಂತ ಅನ್ಕೋತಾರೆ. At times we also feel ನಾವು demigods ಆಗ್ತಾ ಇದ್ದೀವಿ ಅಥವಾ ದೇವ್ರ ಆಗ್ತಾ ಇದ್ದೀವಿ ಅಂತ. But we should keep in mind that we cannot be gods. We are human beings. We have our limitations. We need to address our emotions. It is very important. ಹೆಚ್ಚಿನ ಸರ್ಜಿಕಲ್ ಫೀಲ್ಡ್ಸ್ ಅಲ್ಲಿ ಇಲ್ಲ ಅವ್ರು ಹೇಳಿದ ಹಾಗೆ, I think ಇನ್ನೊಬ್ರು ಚಾಟ್ ಅಲ್ಲಿ ಹೇಳ್ತಾ ಇದ್ರು, ಸರ್ಜಿಕಲ್ ಬ್ರಾಂಡ್ಸ್ ಅಲ್ಲಿ ಮಿಲಿಟರಿ ಸಿಸ್ಟಮ್ ತರ ನಿಮ್ಮನ್ನ ಜಾಸ್ತಿ ಸ್ಟ್ರೆಸ್ಫುಲ್ ಸಿಚುವೇಶನ್ ಅನ್ನ ಫೇಸ್ ಮಾಡೋ ಹಂಗೆ ಮಾಡಿದ್ರೆ ಇನ್ ಫ್ಯೂಚರ್ ಯು ಕ್ಯಾನ್ ಬಿ ಅ ಬೆಟರ್ ಪರ್ಸನ್ ಅನ್ನೋದನ್ನ ಹೇಳ್ಕೊಡೋದಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡ್ತಾರೆ. ಚಾಟ್ ಅಲ್ಲಿ ನಾನು ಇದನ್ನು ಗಮನಿಸಿದೆ. ನಮ್ಮ schooling ಅಲ್ಲಿ we should be equipped to deal with stress. I would say not just stress, life skills. ನಮ್ಮ ಹೆಚ್ಚಿನ ಸ್ಕಿಲ್ ಸೆಟ್ಸ್ ನಾವು ಯಾವ್ದ್ರ ಬಗ್ಗೆ ಗಮನ ಕೊಡ್ತೀವಿ ಅಂದ್ರೆ ಯಾವ್ದ್ರಿಂದ ನಮ್ಗೆ ಮಾನಿಟರಿ ಬೆನಿಫಿಟ್ ಸಿಗುತ್ತೆ. ಯಾವ್ದೋ ಒಂದು ಕಂಪ್ಯೂಟರ್ ಕೋರ್ಸ್ ಮಾಡಿದ್ರೆ ನನ್ಗೇನೋ ಎಕ್ಸ್ಟ್ರಾ ಸ್ಯಾಲರಿ ಬರುತ್ತೆ ಅಂದ್ರೆ we would do that, versus there is another course on meditation, for example, another course on how to manage our emotions. We do not want to do it. ಏನದ್ರಿಂದ monetary benefit. So the skill set should also help us lead a healthy and a happy life. ಅದ್ರ ಬಗ್ಗೆ ಗಮನ ಕೊಟ್ಟು ಎಜುಕೇಶನ್ ಇಟ್ಕೊಳ್ಳೋದು ಸರಿ. ಸಿಸ್ಟಮ್ ಇಂದ ಎಜುಕೇಶನಲ್ ಇಲ್ಲ, personally we investing our time on it and then learning some of these skills, particularly with respect to burnout, recognizing it the first time. PG life you cannot have time, ಏನು ಮಾಡಕ್ಕಾಗಲ್ಲ. ಯಾವಾಗ ಬರ್ನೌಟ್ ಆಗ್ತಾ ಇದೆ, when you're having some of these symptoms, recognizing, acknowledging is the very important step. Try to reverse some of the things, share the work, delegate the work to your co-PJs or other staff members, and then try to have some time for yourself. Our time alli ಏನು ಮಾಡಬಹುದು ಅಂತ we will again discuss. Building resilience, ಯಾವುದೇ ಸ್ಟ್ರೆಸ್ಫುಲ್ ಸಿಚುಯೇಷನ್ ಇರಬಹುದು. ಇಟ್ ಇಸ್ ಲೈಕ್ ದ ಪ್ರೀವಿಯಸ್ ಮುಂಚಿನ ಜನರೇಷನ್ ಅಲ್ಲಿ ಹೇಗೆ ಅಂದ್ರೆ ಈವನ್ ಟೀಚಿಂಗ್ ಅಲ್ಲೂ ನಾವು ಗಮನಿಸಬಹುದು, ಪನಿಷ್ಮೆಂಟ್ ವಾಸ್ ಯೂಸ್ಡ್. ಯಾವ್ದೋ ಸರಿ ಹೇಳಲಿಲ್ಲ, ತಪ್ಪು ಹೇಳ್ದ ಅಂತಂದ್ರೆ ಹೊಡೆಸ್ಕೊಳ್ಳೋದು. ಗಂಗಾಧರ್ ಸರ್ ಸುಮಾರು ಹಿಂದಿನ ಜನರೇಷನ್ ಅವರು ನೆನಪಿರ್ಬಹುದು, ನಾವು ಹೊಡೆಸ್ಕೊಂಡಿದ್ವಿ. ಗಂಟ್ ಮೇಲೆ ಹೊಡೆತ ಬಿದ್ರೆ ಅವ್ರು ಮರಿ ಎಲ್ಲ ಕಲಿತಾರೆ ಅಂತ. ಬಟ್ ವಿ ಹ್ಯಾವ್ ಮೂವ್ಡ್ ಆನ್ ಫ್ರಮ್ ದಟ್ ಸ್ಟೇಜ್. ಈಗಿನ ಸ್ಕೂಲ್ಗಳಲ್ಲಿ ಐ ಹೋಪ್ ಅದನ್ನ ಉಪಯೋಗಿಸ್ತಾ ಇಲ್ಲ. ಹಾಗೆ ಮೆಡಿಕಲ್ ಪ್ರೊಫೆಷನಲ್ ಇವ್ರನ್ನ ಜಾಸ್ತಿ ಬರ್ನ್ಔಟ್ ಆಗೋಷ್ಟು ವರ್ಕ್ ಮಾಡಿಸಿದ್ರೆ ಇವ್ರ ಜೀವನದಲ್ಲಿ ಸ್ಟ್ರೆಸ್ ಅನ್ನ ಚೆನ್ನಾಗಿ ಡೀಲ್ ಮಾಡ್ತಾರೆ ಅನ್ಕೊಳ್ಳೋದ್ರಿಂದ ಐ ಥಿಂಕ್ ವಿ ಶುಡ್ ಮೂವ್ ಟು ದ ಅದರ್ ಆಸ್ಪೆಕ್ಟ್ ವೇರ್ ವಿ ಹೆಲ್ಪ್ ಪೀಪಲ್ ಬಿಲ್ಡ್ ರೆಸಿಲಿಯಂಟ್ ಸ್ಕಿಲ್ಸ್. ಹೇಗೆ ಇವನ್ನೆಲ್ಲ ಹ್ಯಾಂಡಲ್ ಮಾಡಬಹುದು, ಸ್ಟ್ರೆಸ್ ಮ್ಯಾನೇಜ್ ಮಾಡೋದಿರ್ಬಹುದು. As I was saying, there are many life skills, communication management ಇರಬಹುದು, better ways of thinking, better ways of coping, better ways of dealing our emotions. ಇವುಗಳ ಬಗ್ಗೆ ಈಕ್ವಲಿ ಫೋಕಸ್ ಮಾಡೋದಿರ್ಬಹುದು. ಇವುಗಳಿಂದ we can handle the stress better. Some of the tips, because burnout is an individual phenomenon, ಒಬ್ರಿಗಾಗಿತ್ತು ಇನ್ನೊಬ್ರಿಗಾಗಲ್ಲ, and there is not like one effective antibiotic, ಇದನ್ನ 5 ದಿನ ತಗೊಳ್ಳಿ and then the infection is gone. Unfortunately, the burnout is not like that. So I can only give tips. I hope we'll have 5 minutes at the end for us to again come back and discuss or reflect on some of these. Importantly, we need to realize that we are social animals, humans. So turning to other people, closest people, or jothe problem share ಮಾಡ್ಬೋದು. Problem sharing is problem halved ಅಂತ ಹೇಳ್ತೇವೆ. Why does it happen? When you're sharing, ನಿಮ್ಮ brain ಅಲ್ಲಿ you tend to make it ಇನ್ನೊಬ್ರಿಗೆ ಅರ್ಥ ಆಗ್ಬೇಕು ಅಂದ್ರೆ ಅದನ್ನ ನೀವು ಆರ್ಗನೈಸ್ಡ್ ವೇ ನಲ್ಲಿ ಹೇಳಕ್ ಹೋದಾಗ your brain will find out solutions in itself. So that is why sharing is important, openly letting it out to other people, even writing it down in a paper, because ನೀವು ಅದನ್ನ ಹಾಗೆ ಮಾಡಕ್ ಹೋದಾಗ the organizational skills will help you to solve the problem better. Socializing at workplace, PG life difficult, agreed, you have to work 36 hours. Making sure that once in a week all of you co-pages go out and have fun, which can make you equip you to face another 36-hour duty next day. Limiting contact with negative people. Having said everything, there are people who will always say negative things, pessimistic things about future. ಅವ್ರನ್ನ ಬದಲಾಯಿಸಕ್ ಸಾಧ್ಯ ಇಲ್ಲದೆ ಇರಬಹುದು. You can definitely limit your contact with them. Finding new connections where there is a cause like this. It could have been another lazy Sunday evening, but all of us are here together to work on an important, to brainstorm on an important aspect like burnout, work-related stress among medical professionals, because that is going to help. Altruism, give me 1 minute. Altruism is one of the known coping mechanism, one of the healthy coping mechanism, where nam kayalli agidana bereyavrige help madodu. As a profession, we are doing it to the humankind. We also do it to our co-professional, like medical health professional. Adrindanu sahaya agutte. Changing attitude towards work, valuing the work and then reframing it, agala, and balancing it with personal life. Already ivaga helta idru, work est important to aste personal life important. Somewhere it has been neglected. Yaru overwork ಮಾಡ್ತಾರೆ, ಯಾರು ಎಲ್ಲಾ ವರ್ಕ್ ಓಕೆ ಅಂತ ತಗೊಂಡ್ ಮಾಡ್ತಾರೆ, ಯಾರಿಗೆ ಪರ್ಸನಲ್ ಲೈಫ್ ಇಲ್ಲ, we tend to give them more credit. ವಾವ್, ಎಷ್ಟು ಚೆನ್ನಾಗಿದ್ದಾರೆ, ಎಷ್ಟು ಕೆಲಸ ಮಾಡ್ತಾರೆ ಅಂತ. No, we need to be crediting those people who have a good balance, who know to go out of the work at 6 or 8. Discussion idu bantu, whether life is all about getting one and another degrees after degrees, fellowship after fellowships. No, it is also about your personal growth. How better person are you in your personal life? How better whatever that you are in your life. Taking time off when you feel you are getting stressed out, it is your right to take leave and then have it wherever you want to spend on. Prioritizing, saying no, because at times we feel no ಅನ್ನೋದು is like ಇನ್ನೊಬ್ರಿಗೆ ಅದರಿಂದ ನೋವಾಗುತ್ತೇನೋ ಅಥವಾ ನನ್ನ ಬಗ್ಗೆ ಏನೋ ಅನ್ಕೋತಾರೋ ಅಂತ. It is the basic human right. We should all be okay to say no. And then social media, even when we get time, free time, all of you can probably reflect in a day like Sunday, how much time are we actually spending with ourselves, not doing any technology or social media. Either we are listening to a music or watching a TV or in the Facebook or in Instagram. Even the free times that we get are constantly browsing through the mobile. Having some time for ourselves where we do nothing or try to think about ourselves, and then that is going to be very productive. Creativity. All of us have done painting in our school, but how many of us have done it in 48 hours? I'll leave it for you to reflect. When I say this, the school painting helkotaglu, the idea was not ellaru painter agbeku anta, but it is a skill that all of us can have to relax. Iವಾಗ ನಾವು ಪೇಂಟ್ ಮಾಡಿದ್ರು, ಐಡಿಯಾ ಇಸ್ ನಾಟ್ ಟು ಕಂಪ್ಲೀಟ್ ಇಟ್ ಅಂಡ್ ದೆನ್ ಪುಟ್ ಇಟ್ ಆನ್ ದ ವಾಲ್. ನಮ್ ಗೋಡೆಗಳ ಮೇಲೆ ಅವ್ರು ಆರಾಧಿಸ್ಬೇಕಾಗಿಲ್ಲ. ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಎ ವೇ ಆಫ್ ಅಸ್ ಫೀಲಿಂಗ್ ಫ್ರೀ, ಲಿಬರೇಟೆಡ್, ಪ್ಲೇಯಿಂಗ್ ವಿತ್ ದ ಕಲರ್ಸ್. Similarly, many other skills, ಹಾಡು ಹೇಳೋದಿರಬಹುದು, ಹೊಸ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ಕಲಿಯೋದಿರಬಹುದು. If you think everything that you start need to have a functional goal, and ಗಿಟಾರ್ ಕಲ್ತ್ರೆ ನಾಳೆ ಯಾವುದೋ ಬ್ಯಾಂಡ್ ಅಲ್ಲಿ ನುಡಿಸ್ಲೇಬೇಕು, that is a stressful thing. ನೀವು ಗಿಟಾರ್ ಕಲಿಬಹುದು, 10 ವರ್ಷ ತಗೋಬಹುದು ಕಲಿಯೋದಕ್ಕೆ, and you can only play it for your own happiness. Who prevents you from doing that? ಇದನ್ನೆಲ್ಲ ನಾವು ನಮ್ಮ ಚೈಲ್ಡ್ಹುಡ್ ಅಲ್ಲಿ ಸ್ಕೂಲಿಂಗ್ ಅಲ್ಲಿ ಮಾಡಿದ್ವಿ, but only thing is we do not carry it to our adult life. That is where the problem comes. We will go into the details of relaxation and sleep. Few techniques which can help all of us relax: abdominal breathing, using our tummy to breathe, slow breathing in and out, exhalation twice the time of inhalation. More count ನೀವು inhale ಮಾಡಿದ್ರೆ 6 count exhale ಮಾಡೋದಕ್ಕೆ try ಮಾಡೋದು, and increasing it can help you to feel relaxed. Using calm words and phrases, ಹೆಚ್ಚಿನ ಜನ ಈ ತರದ್ದು take it easy ಅಂತ ಬೋರ್ಡ್ ಹಾಕೊಳ್ಳೋದು ನೋಡಿದ್ರೆ, because it will have an effect on your mind. It helps you to take it easy. Giving yourself a talk every time and then say it's okay, things will get better. And using I words, ನನಗೆ ಇವರಿಂದ ಹೀಗಾಯ್ತು, ಅವರಿಂದ ಹೀಗಾಯ್ತು, rather than blaming. ನನಗೆ ಬೇಜಾರಾಗ್ತಾ ಇದೆ, ನನಗೆ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ. It is just about changing the way how we look at the things. Imagery, ಎಲ್ಲಾದ್ರೂ ಅಲ್ಲಿ ಕೂತ್ಕೊಂಡು, for example 36 hours duty, I'm sure you can spare 5 minutes where you can do this. Imagine as if you're on the beach or on the mountain hilltop, and then try to imagine all the senses that you can have. It may be cool breeze of wind, it can be nice aroma of the mud that is coming out in that place, which can relax you immediately. Use all the senses that is possible. Possibly carry a nice deodorant to your duty and then smell it. It can help you relax. Small stretches which can be done in workplace. ಜಿಮ್ ಆದ್ಮೇಲೆ ಮಾಡುವಂತ ಹೆವಿ ಸ್ಟ್ರೆಚಸ್ ಎಲ್ಲ, ಸ್ಮಾಲ್ ಸ್ಟ್ರೆಚಸ್ ಅಲ್ಲೇ ಕೂತಲ್ಲೇ ನಿಂತಲ್ಲೇ ಮಾಡುವಂತದ್ದು. ಅಂಡ್ ಮಸಾಜಿಂಗ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಏರಿಯಾ, ಇಫ್ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಕೆಲವರಿಗೆ ಶೋಲ್ಡರ್ ಅಲ್ಲಿ ತುಂಬಾ ಪ್ರಾಬ್ಲಮ್ ಅನ್ಸುತ್ತೆ. ಸೊ ವೆನ್ ಯು ಕೆನಾಟ್ ಅವಾಯ್ಡ್ ಲಾಂಗ್ ಡ್ಯೂಟಿ ಅವರ್ಸ್, ಸ್ಮಾಲ್ ಮಸಾಜಸ್ ಓವರ್ ದ ಶೋಲ್ಡರ್ಸ್ wherever you feel stressed can help you feel relaxed. Counting number forward and backward. Music. The thing with music is not just letting something go, but being there and listening, enjoying each note that is there in the music, lyric that is there, various instrument that is there, which we call as being mindful. I will again come to that. Having me time, it is the time where you do whatever you want to, even if it is resting for a few minutes without doing anything, that's also totally fine. And nature around, as simple as ಹಾಸ್ಟೆಲ್ ಇಂದ ಹಾಸ್ಪಿಟಲ್ ಹೋಗೋ ಮಧ್ಯದಲ್ಲಿರುವಂತಹ ನೇಚರ್ ಅನ್ನು ಎಂಜಾಯ್ ಮಾಡೋದು. If you are on the phone or over the Instagram, probably we will not recognize there is a nice garden around. Probably being conscious about the chirping of the birds, the sunset, sunrise, whatever is possible. Progressive muscle relaxation and yoga. When I say yoga, it is not just asana. International Yoga Day nal ಮಾಡುವಂತದ್ದು. It is the lifestyle that I am talking about, where we follow every aspect of yoga. One physical exercise is one of them, where pranayama, the breathing exercises, the amount of importance that you give to your mind and then its health. I will again go to the details of it. I'm sorry, it is taking more time than I thought. Mindfulness, mindfulness and takshana ellaru ankoteve it is about meditation. No, we can be mindful about many of the activity that we do day in and day out. As simple as uta ಮಾಡ್ತಾ ಇದ್ದಾಗ, being mindful of all the taste that it brings to you, the smell that it has, the texture that various food particle has. ಎಷ್ಟು ಜನ ಅದನ್ನ ನೋಡ್ಕೊಂಡು ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಐದರ್ ಓವರ್ ಫೋನ್ ಟಿವಿ ನೋಡ್ಕೊಂಡು ಇವಾಗ ಊಟ ಮಾಡ್ತೀವಿ. Each activity like that, being there, giving the maximum importance to all the sensation, is all about being mindful. Regular exercises, food. I need not stress the importance of all this. Medical health professionals, most of you also know about sleep hygiene practice, which is like following a strict discipline for a good alcohol, cigarette and caffeine, socializing, planning finances. This is where the most of the things comes. Our needs are never met. ಇರುವುದೆಲ್ಲವ ಬಿಟ್ಟು ಇರದರ ಎಡೆಗೆ ತುಡಿಯುವುದೇ ಜೀವನ ಅಂತ ಕೇಳುತ್ತೇವೆ. Why does that happen? Because that is how we are made. ತಿನ್ನೋಕಿದ್ರೆ ನೆಕ್ಸ್ಟ್ ಒಂದ್ ಮನೆ ಬೇಕಾಗುತ್ತೆ, ಮನೆ ಇದ್ರೆ ಹೆಂಡತಿ ಬೇಕಾಗುತ್ತೆ, ಹೆಂಡತಿ ಇದ್ರೆ ಓಕೆ ಸೋಷಿಯಲ್ ಸಮಾಜದಲ್ಲಿ ಒಂದ್ ಒಳ್ಳೆ ಸ್ಥಾನ ಇರ್ಬೇಕು, ಅದು ಇದ್ದವರಿಗೆಲ್ಲಾನು ಮುಗಿತಾ ಇಲ್ಲ. ದಟ್ ಇಸ್ ಹೌ ವಿ ಆರ್ ಕನೆಕ್ಟೆಡ್. ಸೊ ವಿ ಆಲ್ವೇಸ್ ಟ್ರೈ ಫಾರ್ ಬೆಟರ್. ಸೊ we should be aware. So Varsha, for you, it is not just at PG. Even after PG there are fellowships, after fellowships there are consultant positions, after consultant position it is our own hospital. So it's basically within us to find that happiness and then contentment. It is not from the external world, and unfortunately we cannot search for it in the external environment. So because it's already almost 6, I'm not going into others in detail. So balancing is what is going to make the difference. I know at times it is not in our hand to change the external situation, but we can definitely change how we prioritize our things. And I will just quick this. And then we can control our mind and emotions only if you take a systematic approach of going through body and then finally going to the autonomic system and then mind, which is called yoga, which I was talking about. Yoga is meant to make us feel connected with ourselves, with the others, with society at large, and with the universe, which is the way to happiness and then contentment beyond our work. So it is not just asana, it is also about yama, niyama. All of you can go back, if you don't know about Ashtanga Yoga, about each of them, and then study and then reach back to me if you have anything more to ask. So I'll not go into differentiating what makes normal and abnormal mental health, and I'll also quit this quiz and then keep it open for people to ask questions. You can also reach out to me on this mail ID, drdruva.aithal@gmail.com, if you have anything more which could not be addressed today. I work at Marga, which is a super specialty psychiatry hospital in Yelahanka. You can also reach out to me there. So with that, I'll stop presenting. I think it's already 6:30. If anyone wants to say anything at the end, I keep the floor open. Thank you so much.
Hello.
Heli.
Very good. Summarizing the totality. Just wanted to mention in relaxation, Dr. Dhruva mentioned music also. At the same time, he's a acclaimed dancer, Bharatanatyam. I think whether it will definitely help. Just one word.
Definitely. Thank you so much. All the modalities of art are known to help us feel better. Art is known to help us feel better.
Okay, actually, because of, I think, heavy rains, Dr. Hema's line got cut, it seems. She had called me. So if she is able to join, she will conclude. Otherwise, I'll take the responsibility of finishing this wonderful discussion. If there are no other questions or opinions, we can conclude. If anyone can raise their hands.
I'm really sorry, Dr. Munishekar Reddy has said, please go slow, important part, but time was running, so I'm really sorry.
I saw his message. He said this is actually an important part of discussion, particularly solutions. Anyway, you could give, you could elaborate many things, and anyway, expressing our what I call inconvenience to Dr. Muni Shankar or Muniswami? Munishekar, sorry. Yeah. We can conclude this session. I thank each one of you, all the participants who have taken their time and participate in this discussion organized by Medical Service Center, Karnataka. Special thanks to Dr. Dhruva Aithal, who has presented very well. Thanks to the participants who have spoken, Dr. Ila, Jyoti, Azaruddin, Dr. Gangadhar, Dr. Sudha, many people who have contributed to this overall understanding of the phenomenon, and also how to overcome it. And I think it's not a one-stop solution. There are many complex things involved, and it's a continuous process, and we have to again reflect upon it, contemplate upon it, and try to overcome the situation. So with these things, we conclude and thank each one of you for participating, and thanks to Varsha also for giving us a wonderful technical support. Thanks one and all. Good evening.
Thank you so much. I was not sure when they said webinar, people will interact, whether it will go well. But to my surprise, this is the first webinar where people have been so much enthusiastic and participating. Thank you everyone for actively participating, and Medical Service Center for giving me this opportunity. Have a good evening.
Okay, right. Varsha?
I will disconnect, sir. End
Yeah. Stop recording.
Okay.
Sir,
Okay.